All right. We have 4 of us, but I'm going to give it another minute or two. There's Jonathan. Here we go. I give it one more minute. We have 5. All right. I have 601. Let's take a roll call vote and just begin. And I'm sure the mayor and Maren will be there shortly. So Shannon?
Shannon Dunham here.
Marissa? You're on mute.
Marissa Carreri here.
Lori?
Lori Garcia here.
Jonathan?
Jonathan Schmidt here.
And Cynthia Kwasinski here. So welcome to the February 9th school committee meeting. Do we have any announcements?
We do. I would like to announce that Center and Pepin Elementary will be having Spirit Week this week from the 8th to the 11th. And all school assembly is scheduled on the 12th. Also at Center Pepin, Mrs. Gauger has coordinated another video from staff to students and families called Pass the Book. Next, I would like to take a minute and, excuse me, I want to say this clearly. Next, I'm proud to announce that the Easthampton High School We the People team won the Massachusetts State Championship for the 4th year in a row and 5th year overall. So I just want to put a big exclamation point there. We the People is a class taught by social studies teacher Kelly Brown. Winning the state competition qualifies the team for the national competition, which will be held remotely in April. The team needs to demonstrate a deep understanding of the Constitution from both a historical and contemporary perspective. It's a highly challenging competition, requiring hours of preparation both in and out of class. It should also be noted that each year is an entirely new team. Easthampton High School has won 5 state championships with 5 entirely different teams. So I think that it is definitely worth highlighting the amazing work that Kelly Brown does and the students of the We the People team. And I hope that we can do something official for them. I know that right now they're gearing up for their big competition in April, but I just wanted to recognize them for the amazing work they did winning the state championship, which was virtual this year, but it is a daunting competition. And for them to do it 4 years in a row is just incredible. And 5 years, overall. So I just wanted to say how proud we were of them. So thank you.
Thank you. That's an amazing accomplishment. It really is. So, all right. Correspondence. We had a lot. I don't know how we're going to summarize all of it.
We'll get through it. Okay, so the first set of correspondence that I'm going to describe here was from an email action. So we received the same email message from a number of people. So I will read that message. It's short. I will read it in its entirety, and then I will read the names of the people who sent independent emails through this email action. So it says, Dear Easthampton School Committee members and Superintendent Leclerc, to ensure a safe return to in-person learning for students, family, and staff, the district must invest the time and resources to implement robust, effective COVID-19 mitigation strategies in all schools. I ask that you opt into the COVID-19 pooled testing initiative launched by DESE in collaboration with the MADPH. So this email action came to us from, and apologies in advance for any names that I mispronounce here, Johanna Andrioli, Caitlin Finneran, Megan Kelly Bagg, LaShonda Stone, David Beauregard, Andrea Marks, Kit Catlett, Vanessa Brackett, Jennifer Hamilton, Abe Phelps, Gail Cannon, Sean Sheehan, Kim Schmidt, Jessica Montagna, Emily Bova, Robin Hubbard, Heather Dean, Elise Langer-Smith, Tracy Durant. There's more, I gotta scroll. Jean Libby, Jennifer Geertsma, Noelle Fournier, Ann Talley, Kara Backend, Megan Harvey, Lauren Wirtz, Casey Ruh, Pilar Goldstein-Dia, Heather Cuthbertson, Harmony Rivest, Jennifer Abbott, Jessica Olson, Heidi Baj, Brianna Capon-Parizo, Chris Camisa, Kristen Dupre, Daniel O'Donoghue, Andy Madera, R. Madera, Heidi Doughton, Siri Scott, Hannah Elliott, Eileen Clavelo, Rachel Breton, Rosa Gagner, Adam Simkowitz, Rachel Nicholas, Quinn Renahan, Mariah Sterling, Susan Mason, Catherine Gonzalez, Nancy Weld, Morgan Jones, Kelly Lauren, Bonnie Ward, Donna Barkham, Michelle Connolly, Joanne Drum, Mark Page, Kayla Moore, Eric Lopensgaard, Michelle Downer, Anthony Parpalarchik, Antigone Lively, Andrea Robert, Adam Frisby, so sorry, Joan Bonsignor, Alexander Alvarez. I really need a lesson in Polish last names. Kelly Grigorich, Anna Lawrence, Carrie Haig, Antonetta Mango, and Kate Pruna. That was all from that same email action.
Thank you.
And then we have some other emails that I will go through now. We have from, oh, Laurie, am I seeing a hand?
Yes, I did want to mention that many people took the time to add to that email, and we appreciated that. It was especially good to hear from a teacher's perspective or a parent's perspective. So it wasn't just that email.
Yes,
So
thank you so much for clarifying, Laurie. Trying to summarize for the purposes of time, but I think that's important to acknowledge. Appreciate that. Okay, so from Desiree Gabri, parent to a first and second grader, asking for the choice for a hybrid or in-person option for families who want and need that option. From Kurt Dellen, expressing support for in-person learning and voicing concerns about the lack of busing for 7th through 12th graders, as well as concerns about the staggered opening plan. From Joseph Wozniak, a parent of a 10th grader, also concerned about the lack of busing for 7th through 12th graders, citing the particular challenge of single and working parents who are unable to provide that transportation during the middle of the day. From Carrie Southwick, also asking for information about the busing, again, expressing difficulties for working families. From Rebecca Tartaglia, writing as a pediatric nurse practitioner, asking for clarification about the staggered return and suggesting that we bring back students to each building at the same time rather than staggering across the building. From Rebecca Resnick-Zellen, also asking about the reasoning for the staggered return and for requesting busing, even if it requires a cost, and making a particular request for prioritization of the junior class at EHS. From Stephen Judd, a parent of a first grader, sharing a report from the Washington Post and expressing support for getting kids back in school. From Kristen Hurley Dedrick, expressing gratitude for the hard work and skills of the educators who are, quote, working miracles each day. Particular shout out from Kristen for second grade teacher, Mrs. Hartberger. And from Johanna Andrioli, expressing support for in-person learning with concern for the well-being of children. And from Lara Macchia, who wrote prior to our last meeting, requesting that we put in place a tentative schedule for reopening this spring, which we have since then done. That is it, I believe. I hope I did not miss a single
That
one.
was nicely done because we did have a lot of correspondence. That was excellent. Gifts?
To my knowledge, we do not have gifts today. I didn't see anything.
Okay. All right. And our next meeting will be February 23rd. All right. And now.
I'm so sorry, Cindy. I actually did miss something. We do
you
have
miss?
gifts.
I thought so. I thought we
it's-
had two,
I
but
passed them on the packet. I'm so sorry. So I would like to please vote to accept with gratitude and appreciation the following gifts. From Barbara Foster, a monetary donation to Maple School, and then also an anonymous monetary donation to Maple School.
Jonathan,
I
it's
would
usually you.
I would second that.
Okay. All right. All those in favor? Shannon? Let's just do a
Shannon
roll
Dunham,
call
aye.
since we're Zoom. Marissa,
Oh, Marissa Carey, aye.
Lori,
Lori Garcia, aye.
Jonathan,
Jonathan Schmidt, aye.
Maren,
Maren Goldstein, aye.
Mayor,
Mayor LaChapelle, aye.
and Cindy Kuzensky, aye. Thank you. All righty. So thank you. I'm glad we caught that. We have time for public speak now. We're going to ask you to say who you are and to limit your comments to 3 minutes. And we will scroll through. I do see Melissa up first. I saw that immediately. We will keep scrolling through. So please, if we miss you, give us a holler. But let's start with Melissa. Thank you.
Hi, my name is Melissa Labar Rogers. I'm a para at Maple School, but I'm also the parent of a first and third grader at Maple School. And my daughter Vivian, who's in first grade, would like to read something that she wrote with her sister, who's in third grade.
Hi, my name is Vivian Rogers. I'm in first grade at Maple School. I'm here today to ask you to think about giving kids one snow day. This year, because Corona is sad and snow days make kids happy. My sister Sarah helped me write this. She is in third grade. Thank you.
Thank you. Okay, we have Chris Savaro.
Hi, good evening, everyone. So my name is Chris Savaro. I work at Easthampton High School. I'm one of 2 school counselors. My caseload consists of students with the last names M through Z in grades 9 through 12. And I also serve as the co-advisor for the Gender and Sexuality Alliance. So as I sit here tonight, I'm curious about the core values at Easthampton High School and how they'll be met for our students with the plan or through the plan that will be decided this evening. Our core values in the nest that we all worked so hard on a couple years ago and continue to work really hard on to meet for all of our students include nurture, encouraging, supporting all of our students together. So that's our nest. That's our nest. I think that our core values and our mission statement of Easthampton High School, they're beautiful words, they're compassionate. I believe them to my core. They also highlight our students' basic needs. And the primary need that I'm most concerned about is our students' physical well-being with whatever plan it is that is voted on and accepted tonight. The need for our students to have shelter, safety, food, incredibly important. So my curiosity, and Cindy, you know my curiosity, but my curiosity leads me to ponder how this reentry plan will model our core values for everyone. I'm curious why we are hearing that transportation is not going to be offered to the students of Easthampton High School unless it's written into their IEP. And that's just a handful of our students, just a handful. I'm also curious as to how we are going to ensure that our students that are here with us for the full day, our special population students, are going to eat lunch in a warm environment. We're hearing they're going to be asked to leave our school, to go out into the elements, to go who knows where to have their lunch. So my curiosity is really high and my concern for our students is really high. I can't imagine living way out on Loudville Road or Ferry and being expected to walk to school. It's not safe. It's just not safe. And for parents to be expected in the middle of the day to somehow arrange transportation for their children, I'm struggling with it. My curiosity is very high. So that's all that I have to say. I'm thinking about the physical well-being, the needs of our students. And I'm also thinking about how important it is as educators, as adults in our community, to model for our students and for our education community, our core values. Thank you for letting me speak tonight.
Thank you. Anybody else? I'm going to keep scrolling through. Lucas?
Hi, sorry, it's actually Peter. I used my son's iPad. And again, actually, the way I'm phrasing this now is actually exactly the point that I'm trying to make. I don't know if it's a school committee itself or if it's an overarching committee that the mayor is in charge of about the public speech. I feel like that a lot of people take the effort to do public speech, and then I feel like you move right on with your agenda without addressing any of the public speech. And I feel there's no opportunity for us to have a conversation with the school committee to discuss certain things or bring certain things up and ask questions and get feedback. And it's all about like, yes, you have your public speech, and then now be quiet and we decide everything without hearing you. You know, like it doesn't seem interactive. It doesn't seem to be acknowledged. Like I brought up a few times transition planning, and I haven't heard yet once in one of the meetings a detailed long conversation about transition planning. You know, it's more like here's our agenda and we go through. So I'm asking that either if it's on a mayoral level, because I don't know how this works, or if it's on a committee level, that you maybe all sit down and have a discussion if there maybe is a once a quarter Q&A option that we can actually ask questions to our elected officials and get an answer, versus like reading out the letters and speaking here, and then you say thank you and then you move on with your agenda. Thank you for your time.
Thank you. Rebecca?
Oh, hi. My name is Kurt Zellen. I'm a parent of two students in the Hampton Public Schools, one in middle school and one in high school. And I would like to advocate that busing is available to all students. I believe that we should stick to the policy as it is written. I think Easthampton Public Schools strives to be a great agency, a great organization. Great organizations don't suspend their policies when it's convenient. I think the students who need it deserve it. I would also like to advocate that the 6-week staggered or 4-week staggered return time is excessive. I would like to hear the board explain what the benefits of that are versus all students returning at the same time. All the schools have different age groups, they have different needs. And I think that it makes sense to come up with a plan that returns all students equally. Thank you.
Thank you. Anybody else? Eileen?
You. I'm Eileen Clavalou. I teach at the high school. And I would like to back up what Chris Savaro just said so eloquently. When we were first informed about the lack of busing for most of our students, most of the faculty at our faculty meeting were horrified. We don't understand how this can possibly be equitable. We don't understand how it can be safe. A lot of our students live pretty far away. The weather, as we know, is very challenging. It's awful out. Also the lunch issue, that students have to go outside and somehow eat lunch in the bitter cold, snow, sleet, whatever, doesn't make any sense to us. And so we're wondering if you could elucidate these decisions a little more so that we can understand and again, talk about the equity issues. Thank you.
Thank you. Anybody else? Oh, that's right. I saw Peter. You're right. Peter Holbrook.
Hi, my name is Peter Holbrook. I'm a junior at Hampshire Regional who plays on the Easthampton football team. I'm here tonight because I want to let you know how important it is to our team to be able to play football this year. We have not been able to be together as a team for a year now. For many of us, football is a major part of our lives, and it's something that we really look forward to every year. For those of us who are juniors and seniors who plan to play football in college, this is a really important time for us to get more playing time. For many of us, playing football is a motivation for doing well in school, and I'm asking you to allow us to have our season. I want to finish by providing you some data on COVID-19 in high school football. A University of Wisconsin School of Medicine and Public Health study researched 207 schools representing 30,000 athletes, 16,000 practices, and 4,000 games, released on October 22nd, 2020, found that participation in sports is not associated with a higher risk of COVID-19 among students. Thank you for your time.
Thank you. Mason?
Hi, I'm Mason Donis. I'm the captain on the football team and a senior at Easthampton High School. And I would really like to build off what Peter was saying and saying I would love to have our season. You know, it breaks my heart to see that this is something that would have to happen with the pandemic and everything. But, you know, I really want to get out on that field one more time. And I know all the seniors and all the kids on my team work very hard, and they put their lives and their blood and their sweat and their tears into this sport, and they love it as much as I do. And I love this town. I love playing for it. And if I couldn't play this year, it would absolutely break my heart. And I know it would for many seniors on my team. And yeah, that's all I have to say. Thank you.
Thank you. I'm scrolling through. If you want to speak, please make sure you signal. Carrie, is your hand raised? Carrie?
Yes.
Okay, you can talk.
Hi. I'm just going to talk about the busing. I am a parent that works outside the home. I need busing for my kid. It's going to be impossible for me to go into work late, figure out how to leave midday to go and get him. I know it's not a requirement of the city, but I also know that we as parents have an option to pay for that. And if we could get a prorated rate or something, this is finally some sort of direction on moving forward for normalcy for these kids. I want my kid to be in a classroom with some of his friends and see them physically. And this is going to be a real challenge for working parents who are not sitting at home, are not able to sit at home and work. I don't have that option. So just if you could just keep that in mind, that would be really fantastic.
Thank you. 3 participants raise their hand. I'm scrolling through. Okay, so we have Keith.
Hello, it's Angelina Cudworth, Keith's mother, and Keith's with me. As a parent of two students in the high school, well, one at Easthampton High, one on the football team, I have to bring up, I have two concerns, one being the busing for the high school students. It's very difficult as a single parent to ask us to figure out our transportation for our kids and work full time. We're kind of left up in the air. We don't even have times, schedules. So I hope that you can maybe work it into and work things out so that they have transportation. Secondly, football, sports for all kids, it's important. These kids need it. I can't stress it enough how important it is for them. It's not just a classroom, it's getting out there on the field too and being with these kids. It's really, really important. Thank you.
Thank you. Myra?
Good evening. I'm certain a number of parents have already said the same thing, but sometimes reduplication is helpful as an effective message. So I would just like to reiterate the needs for equity in terms of transportation and also thinking about ideas for a longer school day. As you know, many parents work. Many parents have one car that work. And as you already mentioned in your last meeting, there's a high failure rate of those that are online receiving, going through the remote model. And that would kind of proceed having people to stay online and having further failure rates for those that don't have transportation. Again, for working parents, there's not a consistent time where you can maintain employment, having to leave your job every day to pick up children. Yes, we know that in person is an option, but I think you've rightly found that being in person is the most effective education for many learners. And I just want you to continue to give explanations as many people are asking the same questions about equity, about common practicalities in their daily lives and how it can be sustained. Thank you.
Thank you. Natalie?
Hi, everybody. I mean, again, I am a mother in Easthampton of two children in middle school and elementary school, and I understand the importance of having transportation. You've, I'm sure, have heard over and over the importance of transportation in many aspects of school life, but I want to stress that because there are even times where, example, my children can't get a bus on a regular school year until October, which is kind of ridiculous to me. I've always thought that was ridiculous. So I'm just saying transportation is definitely an issue. As far as with sports go, and again, I want to remind everybody, I know this is a hard decision to make, both for the school committee and everybody involved, parents as well. And I know it really does stink. It's not easy, but people are dying of COVID. This is not a joke. We're not shutting down sports for people just based off of doing it for willy-nilly. Like, people are dying. And I want to remind everybody, like, whether it affected you or not, you probably don't see it, but remember, there's a reason why the world literally shut down. I know how hard it must be to be a senior in high school, and this is literally it for them, and how hard that must be. And I never want to take away from that, but let's remind everybody this is the real deal, and people are losing their lives. So maybe be a little nicer to people. I know you guys are probably hearing that the worst, but that's it.
Thank you. I hope I say this right. Tanea? You're on mute.
Hi, hi. So I have a couple of things. First thing is the transportation as well. I work full time. My husband works full time. So to have to pick up my son at Whitebrook at 11:30 is just not possible on a daily basis. Also, the schedule for their schooling, they're going to get out at 11:30, but then they have to come home and then log back in at 12:30. I was just wondering, maybe the day could be extended a little bit so they do all their schooling while they're there. Because from 11:30 to 12:30, that's basically when my son would eat his lunch and get himself situated to get back on class. And he does have several breaks throughout the day. So maybe those breaks could be shortened up. They could finish their day. But as far as the transportation, if he doesn't have a bus home, he won't be going because nobody will be there to pick him up. And if I let him walk home, which I'm not going to because it's too far, he would never get here in time to have lunch and log on at 12:30. Thank you.
Thank you. All right, anybody else? Marissa, if you see somebody, I am scrolling through and I do not see anybody right now.
I see Ryan Pickard.
You see Ryan? Is that what you said?
Hi. It's okay if I speak.
Yep.
I am Ryan Pickard, and I am a teacher at Maple Elementary School. And I have not been nervous about returning to school. In fact, I wanted to go back to school in September, but the new variant has made me more nervous. It is a big unknown, and it is a big unknown on the horizon. Both the New York Times and NPR recently reported that in a month it would be the dominant variant and I'm talking about the British variant, excuse me, the dominant variant in the United States. And it is much more transmissible. Again, we don't have a lot of information about it, but we do know that the cases are doubling every week to every 10 days of the information that we do have. And we know that it is 30 to 35%, 40% more contagious. We also know that it's possibly more dangerous. And we know that, masks are less effective and being indoors with other people is more dangerous. One of my good friends works for the NIH and he develops COVID vaccines and COVID tests. And for the first time, he is considering pulling his children out of school because he is nervous about this variant and what it can do to our population by March. So this is something that is a concern of mine. And again, I have not been as concerned health-wise up until this point. And another little, another thing that concerns me is that many of the safety protocols haven't changed in relation to this new variant. Many of the protocols we're working with and the CDC is working with are in place for COVID-19, the original, the original strain. And to me, this feels a little bit like March of last year. It's just a big unknown. And I am worried as a teacher. And I am very happy that, I won't have kids eating in my classroom and then going back to teaching in that classroom for another many hours, or 2 or 3 hours. And I just want to put out a call that we be as cautious as possible when and if we're returning. And that might be different kinds of masks provided. It might be, being as safe as possible with protocols. But it is a concern, and it is a concern for my own family, but also for, the greater community of Easthampton. And I know it's a big decision. So thank you for listening. And
Thank you. Fred?
My name is Fred Murray. I'm a senior and I'm a captain of the football team. I just wanted to just back off what Peter and Mason were saying. Having a season this year would just mean the world for all of us. A lot of guys, we've been meeting up off season, working out, just trying to stay prepared for the season that we hope that we will have. And just having this season would just, as a senior, would mean the world for myself and my fellow teammates. If you take away football from us, we're never going to have this opportunity again to play football. It'll just be gone, never play football again. And just having this season would just, just be the best for our senior year, because I know all my fellow teammates, we go to school, but then we want to do well in school so we can play football, just to be, have a good 4 years. And if we can finish off with the season, that would just be the best for all of us. And thank you.
Thank you. Christine?
Hi. So my name is Christine Holbrook. I'm the mother of Peter Holbrook. I did not have any intention to speak tonight. I was just wanted to be here and see Peter speak. But I felt compelled, after hearing some of the comments so far, to stress how important it is for these kids to be together, go to school, play sports. There have been 18 suicides in Las Vegas. The rate of children under the age of 19 being hospitalized for COVID-19 in Massachusetts is relatively nil. I believe it's definitely under 100. And we all go to the grocery store every day, or not every day. We go to the grocery store, we go out, we go to stores, we are around people, and these kids need to be together and do things. It can be done safely, it can be done well, and people can stay healthy. So that's what I have to say. Thank you.
Thank you. All right, I'm not seeing anybody else. I'm going to scroll through. Going. And Marissa, if you do not see anybody, we will close public speak. Okay, I don't see anybody, so we will close public speak. All right, so let's, I'm following our agenda. Let us go through our subcommittee updates, starting with policy.
Just so everybody knows, I went on the MASC website tonight, and there have been no updates. So we're not going to be meeting at this time.
All right.
Madam Chair?
Yes.
I asked permission to speak outside of the agenda while we have so many attendees.
Okay.
So I just want to make sure everyone knows Thursday, 6 p.m. this Thursday on public access cable channel 193, there will be a vaccination information session with members of the Cooley Dickinson staff, as well as epidemiologists, to walk people through vaccinations and procedures and outreach efforts. This will also be accessible via Zoom, as well as on TV, Cable Access 193. And during the Zoom, there will be an opportunity through the chat to ask questions. It lasts almost like an hour, 6 to 7, and will have some specificity to the city of Easthampton. So I'm just trying to get the word out. You'll get a code red on Thursday morning But vaccination information session, 6 p.m. this coming Thursday. Watch it on channel 193 on cable access, as well as the Zoom link, which will be posted on a flyer that'll hit the city website tomorrow. So thank you, Madam Chair.
No, that's an excellent statement while we have people here. Great. Finance, Maren?
Yep, so Finance Committee just met today for the beginning of our review of the 2021-2022 budget. And so we will be meeting each week for the next 5 weeks, reviewing pieces of the budget and then compiling that all together and reviewing that before our sort of approval of that budget at the subcommittee level to bring it to the full budget. So the full budget will be presented to the school committee at our March 23rd meeting, the second meeting for school committee in March.
Thank you. Jonathan, the collaborative?
Sure. So we did meet since our last meeting. There's a few kind of key points that I just wanted to bring back to you. As always, I just like to sort of highlight when they give us presentations, because I always learn something new about some of the great work that they're doing. This past time, we heard from a one-year program called Building Equitable Support for Children with Disabilities. Again, one-year program. There's very, usually, we can benefit more from some of the things that they bring to us, but there's specific districts working here, but with this program. But my hope is that through the action plans they're creating through this, it's something that they'll share out that, will further help us as we try to bring the collaborative social justice and equity work to our students that have disabilities, because obviously they're oftentimes overlooked. I wanted to update you on their strategic planning, because we did receive a presentation from a representative of Strategy Matters, which is the company that they're working with. I wanted to bring it up because I'll be sharing with all of you a survey that they've passed around for stakeholders. I know you're not as tuned into what they're doing as I've been fortunate to be through our meetings, but I wanted to give you the opportunity to take a look at that. I wanted to let you know that, remind you that I'm going to be a part of their executive director search. They are closed by now. There was a little bit of time left at the meeting, but they received, I think, over 80 applications for that position. And throughout the rest of this month, they're going to be screening those, and I anticipate we'll be participating in some interviews late this month or in the first half of March. And so much other stuff, but I guess I'll end with one key point, which is this would be the year that we would do the spiffy surveys, if you know what I mean. It's something we've had presented here before. It's something that happens every couple of years, sort of looking at the substance use and abuse of students, but also their mental health. And it's something that we talked about at the meeting, wanting to make sure that it wasn't forgotten about. And this is, in fact, one of the years where they would do those surveys. And I believe in March, they're supposed to be generally getting sent around, or at the very least, they'll have more information at that point. And that seemed critical to be aware of, because it'll be really fascinating and critical to take a look at that data. So that's just a bit. Keep an eye out for an email from me as I send out that survey, and I'll include their report that sort of condenses all their great work from the last year as well.
Thank you. Bill did a really great job. So those are going to be big shoes to fill. Good luck. Good luck. Okay. COVID response update, Lori.
Thank you. Since we had such an intense conversation in our weekly meeting, we decided that it would be beneficial for our community to hear from our epidemiologist directly this evening. And we invite Megan Harvey, who we are so fortunate to have working for this district, because we consider everything that you all say, but we want to base our decisions on science. And that's something I've been saying since I appeared on the screen about this deadly pandemic. Megan, welcome.
Thank you.
I'm happy to be here to be of service. I don't know if it's helpful if I talk about some of the stuff that we talked about in the past 2 weeks now, or as Dr. LeClaire is sort of presenting the plan. I mostly just want to say that I'm making myself available. You know, my training as an epidemiologist is that I don't create the research, but I have consumed, I won't say all of it because that's probably impossible, but I've consumed all of the major studies and peer-reviewed research. And I feel really confident that I can break down what that all means for you as you are making your decisions about school and in-person learning and sports. As Lori said, we did have 2 really intense meetings. We meet every Monday. The past 2 Mondays, we've gone over our allotted time and haven't been able to cover everything that we had hoped we would be able to talk about. But there's just a lot of data coming out, as several in public speak have sort of alluded to. We have school reopening and sports and the variants and vaccines, and there's just a lot of sort of ground to cover. And I think Lori can correct me if I'm wrong, but the sort of goal, and Dr. LeClaire, the goal of that team is to make as safe as a return to school as absolutely possible. That's for the children, for the educators and the staff who are going to be in the building. And I really can confidently say that we have not left a stone unturned. So lots of discussion to keep going, but so I don't know, Dr. LeClaire, is it helpful if I get into specifics now, or do you want me to wait until you're talking about
I definitely don't want to hold you up, Megan. I know your time is valuable and I don't want to tie you up at this meeting. So the ball's in your court. Would you like to say something now about the metrics, or I have it on a few of my slides if you'd rather wait until I get to that page in the slide, but I want to be mindful and respectful of your time.
I'm here. I'm happy to just say here, I'm going to be on the meeting anyway, you know, as in addition to epidemiologist, I'm a parent.
And I will stop on my slides that have the metrics and turn it over to you, and you can talk about those numbers and kind of, and I also have some slides with the research. So I'll be open to you jumping in and helping me.
That sounds great. Thank you.
Thank you.
Thank you. So the next thing on our agenda is our superintendent contract update. And I'm just going to be announcing that we will be going into executive session to conduct bargaining with the superintendent, and we will not be returning to regular session. We will adjourn before we go into a regular session, and we will not return. So we will not be back on camera. You will be done with us. So now it is time for our superintendent update.
Okay. Can someone give me sharing?
Yeah, sorry.
Sorry. I have a presentation tonight, and I hope it will address some of the issues. I wrote down pool testing will be discussed. I'm going to talk about transportation, and I'm going to give a rationale for the staggered reentry with a couple options. We'll also talk about the metrics, of course. So I hope to address some of the things that were brought up this evening. Let me just get to my screen and put up my presentation. And can you see that? Can everyone see that?
Mm-hmm. Yes.
Okay. All right. So I am going to jump right in. At the end of our last meeting, I thought my directive from the school committee was to prepare for a return to school. So that's what my administrative team has been doing for the last 2 weeks. So this is kind of a conglomeration, if you will, or a compilation of the work that we've been doing and some of the rationale. So some of the questions that I've heard, why now? Well, I think what's different between last fall and now is the amount of research that has become available to us. We have actual data of school districts that have been in session. We've actually spent the last 2 weeks in the COVID response team reviewing data from a research study. I think it was in North Carolina, and Megan picked it apart and actually called the researcher. So, I mean, we've been really diving into the research that has been made available. Also, I would point out under number 1, Schools in the Path to Zero from the Harvard Global Health Institute. I reviewed the information that they put out in July, where they gave us some clear parameters, but the document was updated in December of 2020. So we really dove into that document as well. And it has been updated really with the idea of students returning to schools. So I think it's fair to say, and Laurie and Megan can back me up here, that we as a team have really spent some time discussing research. Our school physician talks about the research with us. And so it's something that has been part of our consideration as we begin to think about a return to school. What else is going on? Well, we know that vaccines are coming soon for educators. And some people might say, why wait? If I look at an article, I think it was last week from the CDC director in Bloomberg, and I will share all these slides out with everyone. She said it is not necessary for us to wait for educators to be vaccinated. So I think it is imperative that we begin the process. Obviously, you know, it's important for our educators to get vaccinated, but we know that once the rollout comes, people will do it at a different, you know, all different rates. Some people will be right out in front getting it. Some people will hold back and wait. So really, to answer the question, why have we waited so long in Easthampton? I think that number one, we've been very clear and open with everyone that there were concerns that people expressed to us about the air quality and the ventilation in our buildings. And that was something that we felt needed to be examined carefully, and that's what we did. And we've also, I think I've said it before, and I will say it again, I think this group has been conservative, and I think you've carefully wanted to monitor and review information. And I don't think that we have made any decision lightly. I think that we have taken every decision and really examined it from all aspects. So what have we done? And I don't know, this print is a little small, so I'll just read some of it. All of our buildings have been assessed for airflow and ventilation. Air purifiers have been added to spaces where ventilation was less than the ASHRAE standard. I've already discussed that. Classrooms and buildings have been organized to keep students and staff safe. The classrooms have been set up, desks have been removed, they've all been separated. We're using a 6-foot spread, even though which is the CDC guidance, which is 3 feet more than what the Department of Ed guidance is. We have hand sanitizers added in each classroom, signage throughout the hallways and stairways indicating directional flow, space separation. We have isolation rooms in each building for any students that exhibit, any students that exhibit signs of COVID. And we have ordered all recommended PPE equipment for staff and students. So we're ready. What will the schedule look like? The schedule we've decided on looks different than the schedule we initially put in our return to school plan in the fall. And I want to tell you a little bit about why. Again, it's through researching what's working in other communities. The schedule that we're putting forward is 1 week on, 1 week off of in-person learning for students. Why? Because if we have students in our school buildings, Monday through Friday, they're staying together, they're one cohort. When they leave on Friday afternoon, they go home, and they're home Saturday, Sunday, they're home the whole following next week, they're home the following Saturday, Sunday, then they return Monday. They return 10 days later. And that is important, we think, to really keep an eye on transmission of the virus. We want to keep our cohorts kind of spread out. A half-day schedule, no breakfast or lunch served. We're not having meals in school at this time. Students will receive a bag with food that they can take home. It will have their afternoon's lunch and their next morning's breakfast. And so they will have their food to eat. Why did we decide that? Because our educators expressed to us they had concerns about students taking their masks off to eat meals. We heard them. And in addition to that, our COVID response team reviewed all the information, and their recommendation was that we could return to in-person schooling more safely if we took serving meals off the table. So we heard their recommendations. Now, this doesn't necessarily mean this will be the be-all, end-all for the year, but this is our starting point. And so students will be in school for part of the day in person, and then they will go home for lunch and afternoon classes. It will be the opposite for high school. They're going to be at home in the morning and come to school in the afternoon. That's what's being proposed. Now, I want to say that this is through, the support of, that we really listened to the COVID response team. We were trying to take all the information under consideration. 2 educators spoke in public speak, and I just want to address, we did talk about providing the opportunity for students in our remote learning centers, our neediest students, to be in the building all day. And so we had the question, what can we do about lunch for those students? One option was to allow the students to go home for their lunch. Another option is to have the tents up outside and allow students to eat outside. We're talking about a handful of students, but to speak to some of the concerns that have been raised around equity, these are students that could really benefit from having a full day in our building, and we want to be cognizant of that. At our leadership team meeting today, we addressed taking care of those students. They will not be going outside in the freezing cold to eat outside. They will be eating inside, and that's already been taken care of. So that's been communicated with those teachers tonight by the administrator.
Dr. LeClaire, are you comfortable with us asking questions as we
Sure,
go
yeah.
along and
Well,
go through
and if I
these?
don't know, Laurie or Megan might jump in.
Okay, so I have one quick question, and then I see Lori has a question. Why are you having the high school be opposite? What is the rationale to have them in the afternoon and home in the morning? Why is that different?
So it was a few things, and I know Mr. Evans is on the call. I think one of the issues was the circadian rhythm of students. We think that they'll be more awake and receptive to classes in the afternoon. And I don't know if Mr. Evans is here. He was here, if he wants to jump in. Yep.
I'm here. Yeah, I mean, if I think, one of the things that I believe is on your own agenda is looking at when high school students are functioning best. And 7:45, to have them there at 7:45 means getting up at a particular hour. And we know high school students struggle with that. So given the option, I think our students will get better attendance and that they'll be functioning a lot better if they can come at 11:30 instead of at 7:45 in the morning. I think that also might provide us with some more flexibility should we come around to figuring out a way to be able to provide transportation, because then we won't be staggering trying to do our transportation at the same time as the elementary. But that's not something that I can necessarily, speak to here because it hasn't been decided. I'm just pointing that particular feature out. But mostly the decision was made based on, or this proposal is being made based on being able to have increased attendance and better functioning students later in the day.
So I know Lori has a question, but I have a quick follow-up to my question, and that is, I realize I work with teenagers. They love to sleep in and gear up in the later day. But did a survey go out to see if that's okay with families? My concern here is some families benefit and need an older sibling to be home when their younger children are home. And so I'm wondering if a survey has gone out to ask if that's okay with families to have, because that's a major difference. It would mean that the young ones are coming home to potentially an empty house while the older kids are in school. So has a survey gone out to see if that's okay?
So, excuse me, the superintendent survey that went out on Friday did not address the specific times, and I was waiting to see what was going to be decided tonight before I began asking parents to make decisions about or to weigh in on these things. If I really wanted to know what we were doing before I started sending information and making inquiries. So I don't want to jump the gun there, but that is definitely a consideration. Cindy, I appreciate that. It's been pointed out that some families will need their high school students home. There are some disadvantages to having them come in the afternoon. So it's something to be weighed. So we haven't asked the parents just as yet.
Okay. Lori, you had a question before we let poor Dr. Leclerc keep going. And I don't want to waste your time. We have the slides up. And to me, if we have questions on these slides.
Okay. Of course, but I don't have a question. I just know that one of the greatest concerns and questions of our community members is number one here. And because we do have our epidemiologist here, I thought that was a good segue to have Megan start to speak to that. What do you think, Dr. Leclerc?
Absolutely. Megan, the first one, I think the print might be a little small, but is around the unmasked eating period. And that's why we're not going for a full day as we think about rolling this return to school plan out. And I don't know if you want to add anything to why we consider that really important.
Yeah, so we looked at the research and it indicates really strongly that the schools that have not been successful, the schools that have had clusters of outbreaks, by and large, that happens A, outside of school when students are clustered together, and B, when students are unmasked and eating together. It serves a dual purpose of also limiting the number of hours in an enclosed space. And we also know just from transmission in general that that's really important. So it really has sort of solved two of the issues. And I know it's not ideal, but because it's so much of a safer scenario than a full day, a longer period of time in the classroom and eating unmasked together and having multiple sort of breaks like that, we're able to return to school sooner in person than if we were to just say, we'll just wait until we can do full days. If we were to wait to do full days, the research tells us that that really wouldn't be for a little while yet. But we can start now with half days, and that doesn't take away the opportunity to do full days down the road. It just means we do this until the situation has changed and we can do that. Yeah.
Thank you. Thank you. And I think it speaks to the flexibility that we need to have throughout this process, you know, and it can't be just all or nothing. You know, I think we need to be nimble and we need to change and we need to learn as new information becomes available to us.
So are you going to talk about the metrics like on the next slide?
Yeah.
I should have looked at the
Mhm.
slideshow before.
Yeah.
Okay, because it all ties in and it makes
It does.
sense. Yes.
Yeah, it does. So 2 and 3, we've gone over. I will just say about 3, as we've said all along, if you want to remain in remote, you will still have that option. So what are the mitigation strategies we have in place? We have social distancing, hand washing, requiring mask use for all staff and students, no meals at school, air ventilation at 4 air exchanges per hour minimum, the Binax Now rapid testing in all buildings, completion of a daily health assessment for all staff and students is required, and we are adding pooled testing, which I will get to in a later slide. But those are all the mitigation strategies we have in place that the response team has gone through with a fine-tooth comb, and they feel that it is safe for us to begin returning if we have all these strategies in place. When can we return? And this is where Megan is going to jump in.
Masking. I'm sorry.
What?
To jump in and add something about the masking.
Yeah.
So we talked in the past 2 weeks a lot about, as I heard an educator talking about sort of thoughts about the variant that's potentially or fairly certainly more contagious. So we talked about, you know, having surgical masks available for educators to double mask and sort of how that's more comfortable and more effective than trying to layer 2 masks. So Dr. LeClaire, you can correct me if I'm wrong, but I think as we left it, the supply of surgical masks was aplenty, and that would be available for educators who want to safely double mask.
Yes. So the COVID response team chose these metrics, and it was through a consensus vote that they came to these metrics that we are recommending to the school committee tonight. So for a safe return of our special populations, including pre-K, K, and 1, and all of our EL students on February 22nd, we're looking at a metric of 35 cases per 100,000. This was the group that started last fall. And we know that these students are, you know, some of our neediest students. And so we want to prioritize them. And I want to speak from a point of one of the reasons we're staggering, particularly this group, is they need to get back in the building. So Megan, do you want to say anything about that number, that metric?
Yeah, I'll just add in here that, you know, we talked about this a lot, and this is a higher incident case per day than we've seen in the past being put forth. And that's because we have those protocols in the building, because we selected half days. Those allow for us to accept what feels like a little bit more risk, but in reality, we have lowered the risk with this protocol and this school day procedure enough that this is a safe level according to all of the peer-reviewed evidence that we have seen, particularly for this group of students.
Okay. Sorry, I'm going to have a ton of questions tonight. So I have a question. I think this is the place for it. I totally understood our starting with pre-K, K, and 1 when we had one building that we could use. But my question is, now that our buildings have passed, why are we not starting this schedule with all grades? Because we now have all of our buildings that we're able to use. Why are we still staggering? I'm not really clear on that. Lori?
Let me see if I passed the test from our esteemed epidemiologist. So as she just stated, these numbers are higher than we would normally like, higher than we had agreed upon before. So the reason that we are making this move is because of the dire need of these special populations. As Dr. Leclerc said, these were the special populations that we brought back first in the fall. We are not then saying in the pre-K, K, and 1 are going in with the special needs and ELs because they're the ones who have the most difficulty getting on to the remote learning. We hear all the seniors, we hear the juniors, we hear middle schoolers, we hear you all. We want to get everybody in as soon as possible. But just as we had our plans in the summer that was directed by DESE, we needed to get special populations in first. So they're coming in before we have that safety number that Megan will then present.
Yeah, so I was just going to say, we selected, based on the research, a different metric for everybody else, for the second, third, and fourth priority groups, as outlined by the CDC, by Harvard's Path to Zero and school reopening, by all, by Biden's team. All of the main sort of guidelines instruct that we really focus the highest priority on that group, and that we have a different metric, as Dr. Leclerc just put up, that indicates when it's safer for a wider return for students. And so that is going to take a little bit longer because we're not yet there. We're not yet at 30 new cases per 100,000 as a weighted average of the 3 counties, which maybe Dr. Leclerc will get more into, or I'm happy to speak about.
Yeah, so I would say here, the metric, again, that the COVID response team voted on by consensus was 30 cases per 100,000. Now, what I really should do is I should not put a date under under option 1, but tentatively, I could say the earliest would probably be March 8th. Why? Because if our special populations group comes in on the 22nd of February, there's a cohort A that will come for 1 week. Then cohort B, the other half of that group, comes the next week, the week of March 1st. So that means we wouldn't want to start another group until we had the following week. Now, I have put up here, so ignore March 8th because we can shift that, change that. I have added a sequence here, grades 2, 5, 12, 3, 6, 7, 9, 4, 8, 10, 11. This is a staggered re-entry. One of the reasons it's staggered is because we are bringing students into a building that they have not been in over a year. Some of them have never been in the building because it's a new building to them. There are safety, so not only is it a new building, there are safety protocols that we need to train students on. We can't do that. We can't say everybody report to the gymnasium, we're going to have an assembly. That doesn't exist any longer. So we are looking to do this in some organized, safe manner. I'm going to let Megan talk about the metric in a minute, but I also want to say I've put another option here that would accelerate bringing students back. It clusters them into 2 tiers. And I would say, to speak to, I think what Cindy question she raised a little while ago, the third option would be at the beginning of March, we open the doors and let everybody come back. Now we might need to do that, maybe one grade a day or something like that, just to make sure we do the training that we need to do. But there's an array of things that we can do to make this work. Okay. And I hear what people are saying about wanting to get their students in as soon as they can. So these are just some options that we've put up. We've tried to stagger them across different buildings so that we gradually fill our buildings with half of our student body, but we can certainly accelerate option 2 to make it even, we get all students in over the course of 2 weeks, or, we can make it work, whatever your choice. But let me go back to the 30 cases per 100,000. And I don't know, Megan, if you want to shed any light on that number.
Yeah, so on this number, I'll just say that, as I think you mentioned, early on in the pandemic, we were following the best advice from the CDC and from Harvard Public Health, which indicated that 25 cases per 100,000 per day was really the sort of line that we needed to be really mindful of. And we have seen lots of data that has come out since that time, and it was updated at the end of December with the recent data indicating that we can go a bit higher than that, particularly for the younger groups. So we felt totally comfortable as a group in full agreement that 30 cases per day as a weighted average per 100,000 population is a very safe way to bring students back into the building. If they were going to have masks off, be there for longer, we'd be talking about a different number.
Right. And
So
Megan,
I've been
we
trying to
are.
step in and ask a question on this if I could.
Yep.
Okay, thank you. So just to clarify, because there's a lot of different ways that even this metric is evaluated, right? So first off, you've said daily, and that's different than a 7-day weighted average or a 14-day weighted average. And then also, is this Easthampton or is this Easthampton, Hampshire County, the 3 counties? Could you please clarify in terms of those 2 really important factors of how you're determining 30 or 35?
Yeah. Megan, do you want to jump in?
Yeah, this is a 7-day weighted average. My apologies, I didn't say the 7-day part, but it is still the same 7-day weighted average across 3 counties, weighted differently depending on where students and educators are coming from. So much more heavily weighted to Hampshire County. And it is a 7-day average of cases per day.
Can I ask, just since if we are in the process of reevaluating, it was just based on my understanding of the research, though, that it actually was talking more about the 14-day. So could you maybe clarify why you're just looking at the 7-day, which is a lot tighter time frame?
Yeah, so we've talked about the 7-day versus the 14-day. And the gist of it is that as long as we don't use the metric as a on-off switch instantaneously happening, like if we were to use a 1-day, not average, but a 1-day indication, that's much more like an on-off switch. But if we are monitoring this as we go, they're going to be fairly similar, but the 7-day will show us changes that are happening a little bit sooner than the 14-day.
And Megan, where are we now in terms of those numbers?
That's a really good question. And this is one of those places where it really matters where you pull your data from. So if we pull data from just Easthampton numbers last Thursday were at 34 cases per 100,000 population. It's really unclear where that will be this Thursday. But if we track the weighted average across 3 counties, we actually have been seeing, at least in the past 2 months or so, that weighted average is a little lower than Easthampton in general. So they're all sort of in the 30s, mid-30 range. At this point, it's unclear exactly what will happen when this week's data come out, but it is a little bit above that.
So it's the 34, but you're looking at 35 for pre-K, K, and 1, and special pops. Okay.
For the past 2 to 3 weeks, we've seen a steady decline. We are very hopeful that will continue. We sort of talk with each other each week. We look at them, and I copy the school committee on those emails. You know, we sort of look at what's going on. We've seen some more volatility. It's very unclear what will happen when this week's data comes out, but we just have to sort of hold on and keep hoping that we're going to continue heading the right direction.
Right. Okay. Thank you. Dr.
So can I just,
Yep.
I'm sorry, I'm just going to keep trying to dig
That's
into some
okay.
of these details. So I know that Nellie, the president of the Teachers Association, is a part of that COVID response team. So I just wanted to get clear, because the numbers that she has been developing is different from those numbers that you're working on. So I just wanted, if you could clarify what those differences are, and you know, confirming sort of where the teachers union, you're saying this was in consensus, so I'm assuming that means everyone was approving it. So I just want to make sure that we're talking apples to apples, please.
Lori?
Because Nellie cannot speak for her union, she abstained from voting. She did not go against it, but she just said she could not speak for her membership.
Okay. So then maybe if you could clarify the difference in terms of how the data that you're pulling that says we're at 34 or low 30s in the 3 counties versus the metrics that she has been presenting to the school committee on.
I'm strictly speaking on the weekly publicly released data that comes on the county and city and town level. The data that the union is pulling is daily, and then they're calculating a 7-day average. So that one is able to, that metric shows us a lot more of the volatility that I was speaking about in the last email versus, we're going on last Thursday's information, which is really, even the 14 days prior to that, which is far more stable. So in this case, this is one of those times where it does show a big difference. And the only thing that we can do is give it time to find out what's going to happen next.
I would like to stress that this is a collaborative effort. The fact that we meet weekly is something that I do not hear of happening in any other district in this state. I'm not saying it doesn't, but I have not heard of an active COVID response team with an epidemiologist and health professionals sitting down with the school committee member, administrators, and the head of the local union. And I am just stressing this because I want everybody on this call to understand you tonight in public speak heard both sides. I say this constantly, just as we get emails from both sides. But we are trying to make these decisions based on science and sitting together and talking because we value the opinions not only of our community, but also of our teachers. So please just take note of that.
So I will,
Hold on. We need someone to mute. If whoever.
Yep, I do.
Whoever has their mic open, could you please mute? Thank you. Okay.
so we thought very consciously in the COVID response team yesterday about sharing these metrics with everyone. And we decided to share them out so that you know what our target is, because this is not something we can do in isolation. The school committee alone can't make this happen. The leadership team of the school district alone can't make this happen. In order for us to reach 30 cases per 100,000 to get students back in school, the community needs to be willing to make some changes because we do need to get the number down. And so we've got a couple weeks to do that. And I don't want to be the face of bad news all the time and come back to this committee and say, we have not met the metric we set out and we need to postpone a return to school, because nobody wants to hear me say that. Parents don't, the school committee doesn't, nobody wants to hear that. So I think we made the conscious decision to share the metric and be open about it so that people could know that this is the target we have to strive for. So we can discuss.
All right, can I just jump in and say, one of the things that we talked about is that, we might have to hold ourselves to a higher standard than what is coming down in terms of the guidance. So restaurants and bars opened up at higher capacity this week in Massachusetts. And, this is sort of, I think, the COVID response team saying, please consider, getting our kids into school, rather than eating out unmasked.
Yeah, we all have to do our part, I think, is the bottom line. So the big difference here between option 1 and option 2 is a 6-week period versus a 4-week period. I can bring that down even more. If the direction I get from the committee is to bring it down, I can take option 1 even off the table. So it really doesn't matter to me. The issues that we're facing, and again, please don't shoot the messenger, but the challenge we have is, number 1 is transportation. the DESE guidance that came out in the summer around the number of passengers on a bus has severely impacted every single school district across the state. Our 65 passenger buses can only have 21 students on them due to COVID, the COVID guidance. Due to this, we need to have more buses run to transport our youngest students that live over 2 miles. Our littlest ones that live over 2 miles are the priority. So according to the state law, and I did answer a parent that wrote to the committee and I today and said, you know, you have a policy. Yes, we have a policy. And our policy for bus transportation is more generous than the state law. Unfortunately, during COVID times, all school districts have had to revert back to state law. Mandates that we provide transportation to students in grades K through 6 who live more than 2 miles from school. We have done more in the past because we were able to put more kids on buses. And that's how we were able to get around it. Easthampton only has 7 buses, just for people to know. So how can we make this better? And I'm open to suggestions. People can email me. We are waiting for the Department of Ed to change the guidance. The Superintendent's Association has been pleading with the Department of Education to update the guidance from the summer. And I even sit on the executive committee, and the executive committee has been pleading with the commissioner to change the guidance. The commissioner has relayed to us since probably late November, early December, that he is changing the guidance and it will be coming to us soon. But we're waiting for that. It hasn't happened yet. Once he changes the guidance, we can add more students to the bus, which means we can then reduce the number of runs, freeing up more buses so that we can take on more students in other grades that need to be transported. Secondly, the other thing that the 2 pieces that we're thinking of as a school district, if parents of K-6 students that are eligible for the bus choose not to use it, and we're hoping many will, we may be able to consolidate and run less buses and offer some runs for the upper grades. We will also be pleading with families that qualify for transportation for their youngsters, but they can maybe give up their spot for somebody else that really needs it, which is what my counterparts in other districts around us have been doing. They've basically been pleading with families, if you can drive your kids to school, drive them to school and give a spot to someone that really needs it. So those are 2 things that are in play right now. Plus, we're waiting for the guidance to hopefully shift very soon and we can add more students on the bus. And that's where I was going to stop on transportation, but I can take some questions if you want.
Lori, and then I have some.
Yep.
And anybody else on the committee that I cannot see, just jump in. And
yeah, I can only see 4 of you, right? 3 of you right now. So
Dr. Leclerc, I wanted to highlight that second option is being done well in other districts, but it will take our community to be willing to give up their seats if they can drive their students to make this work.
Yes.
So people really have to understand that we want to get kids back in school. We want it to be equitable. We hear that parents are working, that they can't provide the transportation, but I truly feel that this community can come together because we want our students back to give up their seat if they know someone else needs it.
Right.
I have a few questions. Oh,
yep.
Yeah. So one question around this is so when we're talking about DESE guidance, is it just the word guidance, or is that a mandate?
It is a mandate that every school district in the state of Massachusetts must follow.
Okay. And so the next question I have, with putting I guess putting aside money, which is there an advantage to the district to contract now for more buses with the existing guidance? So when we do start upping or the guidance changes, we have procured those buses already. And then part two would be about money. Will the two new pots of COVID relief money that the schools will get, can they pay for additional buses?
Sure. So I'll start with the first one. As you can imagine, when this guidance came out in the summer, for many school districts that were heading into hybrid in September, the scramble began. There are no available buses right now in the state of Massachusetts. I can tell you that we have checked with our contracted bus vendor, Durham, and Hampshire Regional ordered new buses over a year ago before the pandemic began, and they have not received delivery of those new buses yet. There are no buses available, and we've confirmed that. I actually had Dale reach out to Durham today to ask again if the situation has changed. There's no access to additional buses. Nobody has additional buses. Now, what we have discussed as a team is looking at the vans that we run through Vanpool. And for example, I've heard it said here tonight, maybe not specifically in these terms, but for some of our neediest students, the students in the remote learning centers, our ELL students, we are planning on putting them on vans if they need transportation. We're going to take care of them because they are the neediest students. And so we've been talking about, we'll use funds that we have through federal dollars to pay for additional vans, because that seems to be a place where we have some flexibility in getting some students into the buildings.
So
Did
how
I
are
answer
you?
both parts?
I think so.
Thank you very much.
So how are you going to implement that? Because I am concerned that we want to open up schools and there are many, many families who need to have their children brought to school. So how are we going to do this? I love the idea of getting as many vans as we can to do this. How is that going to be implemented so that the families that really need to have their kids brought into school and brought home will be able to do that? Because I totally understand that there's a shortage now of buses, but I think we need to be extremely creative and use whatever CARES funds that we can to figure out, now, if we're going to get the schools open, let's get the kids in, because it does no good to open the schools, but we're not giving kids a ride in. I cannot. As soon as I heard about this, and I just want to let the public know, we have just heard about this plan with the busing, the school committee, and so we're just trying to wrap our heads around it too. So again, how are we going to implement it? How many vans are available? How many kids and families can we get in? And then my last question is, maybe we do a staggered entry with students. So we use a van pool, and some of our kids come in a half an hour late, but they're in school. They got there. And they go home a half hour later, but they got home.
Well, we are doing some staggered times. The elementaries have different start and end times than the middle school does. So it is staggered that way. Keep in mind, we have about 3 of our 7 buses every day tied up with our vocational students. So it's, and that CTEC, our collaborative VOC students, they only go half day. So there's a morning run, a midday run, then another midday run, and then an afternoon run. So that ties up quite a few of our buses. So, when we talk about this half day program, we also have to take that into account. We're trying to bus students home at a time when we have the least amount of buses at our availability. So there's a lot that we're thinking about and trying to plan. We're trying to see, can we, I want to back up here a second and say, the directive from the last school committee meeting was to begin the return to school process. So the transportation information just came out last week to families. So it is fresh and it is brand new, and we're still working through all of this.
Right, it's all a work in
Gail
progress.
is still, we're determining who is eligible, who needs it, who wants it, who can we, the next piece we're talking about today was sending out a plea to families that qualify for the bus to say, would you please consider giving up your slot if you don't need it? So that's the next step that we're looking at. Sarah Mochak, who oversees the van pool piece of it, we talked today with her. She's exploring the van pool option. We know in particular of some students in our special POPs group that don't have transportation in a written IEP. They maybe need transportation for other reasons because their family can't get them to school. But those are the kids that we have her focusing on providing the vans for, and she's working on that. But this is a moving, ever-evolving situation. So those are the things we're working on this week, and we'll continue to work on them next week. The reality is we're starting with that special POPs group. So we have a couple weeks to build our plan a little bit. We have some flexibility in building our plan. So we're continuously adjusting this, and I'm hoping that the guidance is going to change, or we'll hear when the guidance will change. We have a call with the commissioner this Thursday, and I know it will be part of the discussion.
So if I could just jump in, because you're not seeing my hand raised, Cindy. So
I'm sorry, I'm not.
no, it's okay. So I think that there's a couple things that I just want to throw out there. One is, the guidance was there for a reason. And so of course we want to be able to get our kids to the school buildings if we want them in the school buildings. But the distancing is also still something that we want to look to how to maintain, right? That there was reasons for that for safety reasons. So I personally don't necessarily see that as the fix, because that actually just pushes us so that we're likely not to actually have that 6-foot distancing that we want to have in schools. So why are we suddenly putting kids through that situation on school buses to get them there? So that's, to me, is not to them. I mean, we've said this numerous times, DESE has not necessarily had its finger on the pulse and has not paid attention to science throughout this entire school year. And so unfortunately, I don't necessarily think we should be looking to DESE to change this number so that suddenly we can use the buses the way we have in the past, for instance. So that's piece one. Second piece, I also have the very similar concern with thinking about the vans as a real solution. Because here again, I mean, how many kids can you get in a van that actually has distance?
Yeah, no, I'm not, I want to be clear. And if I was not clear before, I'm not looking for the vans to be the solution to our problem. I am trying to address a concern that was raised, and I probably wasn't clear, for some of the neediest students we have. This is really about need, not want. And I think, that's something we need to be very clear about. And I appreciate, Maren, that you make that point. We cannot expect the same level of transportation access that we had last year. The state of Massachusetts has decreased it by 2/3. We can only have 1/3 of the students. So it has forced us to think about this in a really critical way. And, I got worried and I reached out to some of my counterparts in the area to say, are we doing something wrong? And they said, no, we're all doing the exact same thing. We
So
can't
if
transport anyone.
definitely. So with all of that, and I think in agreement and serious concerns from all of our perspectives, and very much understanding the concerns that the community is saying. One of the things that I think about it is you've mentioned staggered times, and yes, we've always had staggered times for our different levels. But I would suggest us to look at what if we severely staggered those times, so that you had the ability to go get pre-K through 2 and then 3 through 5, or not, that's not actually true because 5 is in middle school. So, but pre-K
Yeah, I
through
know what you're
1 and then
saying.
2
Yeah.
through 4,
Yep.
so that we still get them all to their schools, and those grades then start an hour difference in
Yes.
order to be able to get them all to school. I think we just need to look really out of the box, and if we need to shift around the school day in order to actually get our students that need to be in the schools to the schools. I mean, we want to have them there, so let's get them there properly and safely. I think we need to really look at how can we adjust the school day so that each of those kids that need to get there through transportation can get there.
Maren, you took the words right out of my mouth. I totally agree. I don't want to give up the restriction on the bus. I think that will keep our kids safe. And that is really what I was envisioning when I was talking about staggering our times. You come into school, you just are starting your day at a different time. I think that we need to be as creative as we can so that we can provide transportation to all the families that really need it. And I think we've got to do some reaching out to find out what numbers there are. But also, I love the idea of really, you start, first grade at a different time, and second and third, and then the same at the middle school. You start at a different time so we can pick these kids up and bring them home. Again, this is a revolutionary idea, but these are unbelievable times. We've got to be creative.
I will reach out to the bus company tomorrow and see what if any challenges there will be, and I'll get with my team tomorrow and we can kind of hash that out.
And even as I put that forward as a possible solution, I also want to be cognizant of, that puts in question our teachers, and some of our teachers have their own children. So there's a lot of ramifications to that.
Yes.
I recognize that it doesn't just suddenly become an instant fix. And so I definitely don't want the community to suddenly think that there's an instant fix to this. There are many different factors to play into that, but I just think that in particular might allow for more bus routes to spin through our communities, because like you said, there are no more buses. So this isn't about adding more buses, but if we can do more routes in the same day, we might be able to get more of our students in there, as long as all these other factors can come together.
Yeah, I agree. This is a horribly complicated issue. Go ahead, Lori.
But that's also another reason to have a day that is not a full day, because we could stagger it. It could still be within the teacher's contracted hours, and we get the kids in school.
Thank you.
Can I sneak in?
Hi.
Please?
Yeah.
Hi. So I wanted to ask a couple of questions. Allison, how many students do we have going to CTEC?
We have CTEC is a half-day program.
Yeah.
So we either have, we have like half of our student group going in the morning and half going in the afternoon. So they're about a bus for each part of the day. They're about 20 to 21 students, I think, on each bus, if they're all jumping on the bus.
You said 3 buses were dedicated for 4 different runs.
Yep.
Not
So,
really the case.
so Smith Voc in Northampton does a run. I think Smith Voc actually does 2 runs. I think they split the city in half to get those kids to Smith, and they spend the whole day there. Okay, so they only go morning and afternoon. And then CTEC does one loop through the town, picks up all the kids in the morning, brings them to CTEC, then they come back to the high school midday, and then another bus goes out midday, goes through the town, because they can't do it the same bus time-wise, goes through town, picks up the afternoon kids and brings those kids to CTEC, and then brings them back home in the afternoon.
Okay, so before, when the CTEC kids were going, they were going from EHS. They're actually being picked up at home now?
That's what we did this year because we were in remote.
Okay.
We were in remote, yeah. And again, to speak to an equity issue, we made the decision at the beginning of the school year. We said, we got to get those kids. It's not their fault. They're not in school at the high school. So we made the decision. We had the bus available. So we went around and picked them up.
Okay, so those 3 particular buses aren't available to our students that are in our school district in Easthampton. Like they're out of those.
It depends on the timing of it. So
at some point they
maybe we could use a Smith bus depending on the timing of it once they did their morning run.
Okay. Now, as far as the number of students on a bus, now is it based on spacing, or is it based on, like, can 2 kids from the same family sit in the same seat?
Yes, that is the exception to the rule.
So
Yes.
you can that adds 1 extra person to the bus, and that's okay.
Yes. Yes.
Okay. I can't remember what the other question was. I didn't write it down. Sorry. I'm done. Thank you very much.
You can come back, Shannon. Just chime in when we don't see you.
If I could just chime in real quick. First, Shannon, you addressed a couple of things that were on my mind, so thank you. Second, I mean, I wonder if this would just be a good opportunity to ask maybe Megan to weigh in, because I know there's been research done specifically as it relates to COVID and traveling in vehicles, and I'd be curious to hear your thoughts in terms of the spacing of the current guidelines, and if the guidelines were to change, how that would sort of change your opinion of things.
Yeah, so I have actually just read some research about this, indicating that you can actually get something like 20 to 40 air exchanges an hour on a bus if you have the windows down, multiple windows down. So that's a key component, ventilation, right? And so that means that you've checked off one of the things that's required. That doesn't mean you can safely go under that 6-foot distancing. So the seat spacing will apply.
Yeah.
I think what it means is that if you can be really strategic about what the bus route is,
Yeah,
right?
but you
Find
gotta
out the
get
families that need, if they have siblings that can be picked up, and so that you can stack the bus.
I can't get anything until you do some Zern.
Okay, we have somebody.
You can't go.
We have somebody unmuted again. Could you please mute yourself so that, thank you. Go ahead, Megan.
I didn't catch that last sentence.
I didn't either.
Yeah, so I was just saying, the other thing is being really strategic. Once you find out the people who are in need, stacking bus routes, even if it's not geographically the most logical route, if you can stack families where you can line kids up in those seats in the spacing, you might have some wonky bus routes that you wouldn't repeat in a normal typical year, but you might be able to get by and get some more kids in the bus.
I love it. I just think we have to be as creative as possible. Yeah. Anybody else before we go on to another slide? We have some time to work this out, so that at least makes me happy.
So pool testing, I know that was the source of a lot of emails we received this weekend. So I wanted to talk about that and let you know that I heard the will of the people, and so I applied to be in the pool testing pool yesterday, and I've already heard back from them as far as completing the application process today. So I want to backtrack a little bit and say that Easthampton went through all the required trainings back in January, and we looked at the program at that time. I spoke with the RNs in the district who went through all of the training. I went through a piece of the training, but they went through multiple webinars, and they felt their recommendation to me was not to take part in pooled testing at the time. And they had a few reasons for doing that, and I can get into that. So I took their advice and decided that we would table it for now. And with the idea that there was a 6-week pilot starting, and we would wait and let some other schools that are already in session do it because they were going to be part of the pilot. There's one kind of, within a 30-40 minute range of us that I know the superintendent. There's no one really nearby that I know of that's doing it. And I said, well, we'll let some others that are actually in school right now do the pooled testing, and then we'll hear how it goes and what they learn from it. And then we'll decide if we want to engage once we come back in person. So that was the decision we made. I think that the educators felt differently about it, and I respect that. And it has been discussed at our COVID advisory committee meetings, which our RNs are part of. So it's not anything that's new to them. But so I did put in for it. There is for those that don't know, there is a 6-week pilot that the Department of Education is putting on. If we return on February 22nd, we would be able to take part in about 3 weeks of that pilot. So we would have an abbreviated time frame in which we could kind of see how things work. And then we can assess what we think of the program. So that will be a short, quick turnaround. But I think that, we'll also kind of reach out to other schools and see how they did for a longer period of time. I think the success of the program will depend on the number of people that participate in it. Because we really need, in order for pool testing, and Megan probably knows way more than I do, but in order for it to be successful, you need to have most people involved in it. So we really need to get community buy-in from our families, and we need to get our educators to buy in. But I think that the emails that we received are evidence that our educators do have buy-in. So I'm happy to look at this program and see how it works for us. We will, if we decide to continue on after the 3-week pilot that we would be involved in, there would be a cost associated with that. It would run about $10,000 a week to do the testing. We would have to take it out of our ESSER funds, which are our federal dollars. It could be, if we ran it for the rest of the school year, it could be approximately $120,000. So it's a huge investment for a district that struggles financially. So I'm very cognizant of the dollars that we have. But I think that it's something that I think teachers are expressing that will make them feel safer for a return to school. So I'm happy to explore it. I do want to say that one of the concerns the nurses raised, in addition to the buy-in piece, was it's a lot of work to ask of our nursing staff. It will be on their shoulders, and they will be busy during the day. And this week I've gone around to have some kind of town hall meetings with educators in the different schools. And, we've talked about the fact that you really need to think carefully before sending a student down to the nurse's office for a Band-Aid or something. Nurses are going to be kind of tied up with some of this work. So we really want to be cognizant of that and mindful that they have a busy job, especially during a pandemic. And I don't know if I had another slide. Oh, so that's all I had. So I'll take any questions if anyone has any questions about pooled testing. Happy to discuss.
So I have a question.
Don't claim to be the expert, but go ahead.
I love the idea of pool testing. We are starting it in my school district, so we're very
Oh, good.
hopeful. And I do think it has the potential to be a game changer, especially in terms of building confidence. So my question is, I do understand that it is labor intensive. Is it possible that we could hire during that 3-week pilot period? Could we hire, an extra nurse as a sub to?
Well, it's interesting you asked that. Actually, one of our RNs is going out on maternity leave, and so we've had a job posting up for substitute nurse. And I said that we would hire one or two. I would take one full-time person, two part-time people, whatever combination. And I don't think it's shocking to anyone on this call. Nurses are in pretty high demand right now.
Yes.
I mean, they can go to a vaccine clinic and make a ton of money. They don't
Right.
need to be showing up at an elementary school and helping kids put a Q-tip up their nose. I mean, it's just, I can't find anyone. We've got postings out on Indeed.com, School Spring. I mean, we're looking high, we're looking low, but nurses are pretty hard to find right now.
Okay. Lori?
Marissa, do you want to go? I've spoken a lot tonight. You
Okay.
go first.
I just had a question about.
I can't hear you. It's hard to hear you,
Lori,
Marissa.
you gotta be, thank you.
It's those
You're letting her-
headphones, Marissa.
Is this something that we can require of students, or is it something that families opt in on?
Families
is
have
there
to
like
opt in.
is there a threshold of of participation at which it becomes useful? If we have like 50% of families who opt in, is it even a valid measure?
I'm not sure statistically. That might be more of a Megan question, or I could ask one of my nurses. What I've been saying to teachers, if you have 8 students in your class coming in for cohort A, and you are opting in as well as the teacher, if all of you are getting tested, then it's going to give you good information. But if it's just the teacher and 2 kids, it might not really help, you determine anything useful. Because again, you're going to have like 10 days in between when you see that cohort again. So I don't know, Megan, do you have any idea about that?
Yeah, so it's most effective when you can get as many people as possible, ideally 100% to do it. It is still effective at lower levels because it's still individual tests. So I don't know if it's helpful if I explain how pooled testing works.
Yeah, go ahead.
Okay, so pooled testing through the company that is providing it for Massachusetts takes a pool of 5 to 10 people, and their guidance is to have, maybe one educator, one staff member with a group of kids. And so what happens is those samples get combined together and they go out for testing. This allows you to test far more people with way fewer resources. And so the ideal situation is that pool comes back negative and then you're done with it. You can just say, we're all clear, this is great, and you move on and wait till next week. If a pool comes back positive, you have to test everybody in that pool. If they choose not to get tested, then they basically need to assume that they're positive and start their asymptomatic isolation.
Right.
Assuming that they're asymptomatic. If they're symptomatic, it's a whole other kind of isolation. And my understanding, everything that I have seen from the state is that the Binax Now rapid tests are allowed to be used for that pool that comes back positive.
Yes.
So it's sort of one-stop shop where if your pool comes back positive, you'll find out 24 to 48 hours that your pool is positive, and then everybody can get their individual rapid test. And it will make a big difference in terms of preventing spread. If there is a small cluster, it will contain it. And it probably, if we do have cases in the school, will not allow it, will prevent it from going into multiple classrooms.
Thank you.
And just to reiterate what Megan said, and this was one of the mitigation factors we had several slides ago, we have the Binax Now rapid test in all of our schools in the district. So we are prepared to use that. We've gotten all the clearances for that.
The other thing, I'm pretty sure that for the second graders and up, they'll be self-administering. I know it doesn't mean that it's no work at all for the RNs, but it helps a lot if you don't have to swab
Yeah,
every.
right.
Most of the kids will be swabbing their own nose.
Right. Lori?
I would just like to ask for clarification on, I think you said it was ESSR federal funding. Is that the CARES Act funding? Is that the same thing or is that different? Could you please explain?
We have two pools of money. CARES funding came to the schools last spring. We haven't not received another allocation of CARES funding, but we have received ESSER funding, and I forget what it stands for, but it's federal funding. And we received one allocation last spring, and we just received the allocation for our next round of ESSER funding, which we have to apply for, but it lasts for the next 2 years. I'm sure we'll use it up before then, but ESSER funding is from the federal government, and it's based on our Title I numbers.
I'm just asking because I know that the CARES Act funding had ended in December and then was reinstated with actually more funding in January, if I'm correct. So I'm just wondering if we need the money, even with extra buses, with vans, if
we've used most of our CARES funding already.
Even the new money from this year? That's what I was wondering.
There wasn't a second allocation. They increased the first allocation slightly.
Okay, thank you.
Shannon?
I just had one more question.
That's
I
okay.
did write it down and I just missed it. Remote learning centers. We talked about that a little bit. Is that going to be a full day, half day available to students on their opposite week? I'm just curious.
The answer to your question is yes, to pretty much all. So it's a half-day program. I think, I'm not 100% sure at the elementary level. I think it's half-day program, and it would be opposite the week that they're in school. Okay. But at the high school, it is either you could go half-day or full day. Bill, am I getting that right?
Yeah, so what we'll do is we'll offer
a
morning session and an afternoon session, and students can choose one, the other, or both.
Okay, so like if their classes are in the afternoon, they can come in the morning so that they're at school all day.
Correct.
Yes.
And
just the high school, not Whitebrook. Or
I'd have to confirm, Shannon. Bill's the only one that's really been talking about that, because he's been trying to really get these kids all set up. I don't, and Bill honestly had his remote learning center going last fall. Right. So he really had a model up and running kind of. I'd have to check with the middle school and the elementary. I'm not 100% sure.
Okay, thank you.
So I think I need a vote from you. I think I need a vote to begin the return to school process with the special populations on February 22nd. And then if I could get any kind of consensus around how rapidly you'd like the rest of the group to come back, that would help us kind of form our direction. So I don't believe, so this is my thinking, and you can tell me if I'm incorrect. I don't believe after you take this vote tonight to begin the return to school, I need to come back to you for another vote every time we want to add students. I think the only thing I would come back to you for is if we had some metrics that were going the wrong way, and the COVID advisory team met as a result of those metrics, and the advisory team recommended to the school committee that we maybe shut down for a week or two, then I would come back for you. But I don't believe, I think I just need a vote on this tonight. And can I just say one more thing? And I know Laurie has her hand up, but I think Laurie would think this is important. I want to just say that the consensus of the COVID advisory team that met yesterday, and everybody was there, was that we should return to school. That's our school physician, our epidemiologist, our city health director, that's everyone. And Laurie can piggyback on that. There was their consensus and they
Yes.
wanted me to share that with you.
Yes, and I agree with that 100%, but I do want to stress that we have to pay attention to the metrics and there has to be protocol. So if we get metrics on Thursday as a committee, we have to agree. We wouldn't even need to meet as a COVID response team because we've already decided on those metrics. But as a school committee, we would need to be able to meet for an emergency meeting on a Friday, for example, or even a Saturday, and determine that we would have to go into a remote on Monday. And people have to understand that. We have been so careful and we do not want to have our students, as I've said, ping-ponging around. We're going to be very deliberate in our actions, but if we're going to vote on this, we have to have something set up to know how we can turn it around.
Right. Marissa, you're on mute.
I'm very interested in voting for the return of the special populations. I am hesitant about voting for the remainder of all of our populations without returning to this conversation about a more creative staggered opening structure that would allow us to offer transportation. I'm just a little afraid that if we give an approval to move forward and without ever having a chance to meet to have a new proposal to ensure that more kids can get on the bus.
Okay, Megan, before we all start.
Yeah, so if I may, I think specifically the request from the COVID response team was that the school committee votes on those metrics. So 35 per 100,000 for special populations, including K&1, and that the metric is 30 for everybody else, which I think addresses part of Marissa's concern. Not
So,
but a metric.
Got it. Thank you.
So first of all, thank you, Dr. Leclerc, and everybody who worked on this reopening plan. We are asking a lot of questions and we are taking jabs at it. It is not that I think that you did not do your best to think about all this. It's a very, very complicated issue. Every step we take forward complicates something else. So, you know I've asked a lot of questions and I have some things that I really want to push for. It is not that I think that good work has not been done. So I want to preface with that. I really want our kids back in, and I think that I like the idea of the 35 and the 30 as metric numbers. I do. I'm absolutely willing to have emergency meetings when, we've done that in my district. We've met on a Saturday. It's an emergency meeting. You don't have to wait for the 2 days to post. You just have it and you figure where you go from there. So I'm absolutely ready to move on a dime, should things change. And I am, before I even talk about this, I am really imploring Easthampton families to be safe. There are districts that have been able to go in hybrid and special pops and then had to shut down because families did not behave as they should and did a lot of visiting, and the numbers climbed and it smashed everything down. So we are really working to get in and to stay in for the rest of the year. And that really takes commitment from everybody in the city. So I'm really begging people, if you really want your kids in, we really need you all to behave and to stay safe. So a couple of things really quickly, and I don't know how we do it. I'm okay with the 35 and the 30, and I don't want to take up all the time. I love the idea of getting pre-K, K1, special pops and remote learning in on the 22nd. We do have a meeting on the 23rd. My feeling, though, is that we need to speed up the schedule after that of getting the other grades in. I can only share what we did in my district. We did bring kids in a grade at a time, but it really only took one day. So you bring them in on that day, you bring grade 2 in on that day, and you take them through the building, and not a lot of learning's going on because they're going to learn on that day. This is how you stay 6 feet apart. This is where you're going to sit. This is how you're going to wash your hands. And you take them through that protocol, and then they go home. The next day you do 3rd grade, and 2nd grade is now settled in, and you build. I just think that we can do it a little faster. And I'm really hoping that we don't have those buildings empty. You've got that high school, you've got that middle school. Let's get the grades in one day at a time, teach them how to behave, because it is a behaving thing. And I don't mean that like they're all gonna misbehave. It is, you have to know how to operate, and the teachers will need to talk the kids through it. But I've seen it really only take one day and then a lot of reinforcement. And it's been a long time since these kids have been in. We would have opened up earlier had our buildings been able to be used. And I hope the public understands that. We couldn't use the buildings. We can now. We have them all set up. And now we really do need to get those kids in. So I would like some sort of plan to get them in faster. And again, my personal belief is one day of training per grade would work. I've seen it happen. And then I really want some creative staggering. I don't know what to do. I really don't. Whether we do a survey and we reach out to families, but we really need to work on how we're going to get the kids that need a ride in to get in. So that's me. Lori?
I agree with everything you said, Cindy, but I do want to stress that many people are concerned that we are bringing special populations in the day after February break. And I have to tell the community, it is up to you. If you want to see everyone come back, it is totally up to you to not be traveling in February, because if our numbers go up, we're going to just close the schools again. I'm going to just say it just like that, because you are going to determine how we can educate our children remotely or in hybrid. And it goes the same with opening up restaurants more as well. If you're all going to be sitting en masse eating and drinking, then the numbers are going to go up. And we're going to be paying close attention. And as I just said, we will close on a dime.
Yeah. Dr. LeClaire?
I want to be clear. I think we can make anything that you've expressed happen, but I think for the sake of, I'll start with the families, our staff, and our administrators. We need more than 2 weeks to really do this well. And what I mean to say by that is, if you vote tonight only to bring back the special populations on February 22nd, and you don't consider the next group, what's going to happen next, our administrators really struggle to get everything prepared. If you're waiting until February 23rd to decide the order and the sequence and the stagger, then it's a madhouse for our administrators. I think that really you need to vote to return to school in your language that you're saying, and make the options that you want. It's up, you need to be telling me that I need to work on the staggering of the buses. That's not anything that you need to be contemplating as far as your oversight on the school committee. You need to direct me and my administrators, but in order to do that, we need some time. You know, as you've heard tonight, Mr. Evans gave a perfect example. You know, he really is waiting for you to say, yes, this is a go, before he goes the next step with families, because we've had so many, like, you know, we've put out information before and then we've kind of had to pull back. And so we don't want to give people false hope, you know, and I think it's really important that we're clear and we're moving forward. So,
I agree.
I just want to advocate for the families that need to plan, for my
Yes.
educators that need to plan and figure out when their first day in school is. You know, we need to get training for them. They need to get their classrooms, you know, all
I
set up.
totally agree. I totally agree. And
Thank you.
even the idea that I threw out about, you know, you train first grade on this day and second grade on this day, you still, everybody needs to know what the picture is and have it mapped out. So I totally agree that you need to go ahead tonight on what we're going to do. Absolutely. Jonathan?
So just a couple of thoughts. First, I'll say that I agree that it's definitely possible and a good path forward to speed up the process a little bit. What I'm thinking about as we talk about this sort of day-to-day process, keeping in mind that we're doing a 1 week on, 1 week off model. I'm just thinking of the students who are coming in towards the end of that week and sort of getting the first day on, say, like a Thursday or Friday, and then turning around and having to go back home theoretically for the following week. I would say it's probably going to be disruptive to their sort of development of the habits that we're looking for from them. And also just kind of disrupts their schedule in a way. So I think my preference would be to lean towards something in the vein of I think it was option 2, where instead of where I think it condensed into 4 weeks, we have the it seemed like 2 grades more or less at a school at a time, and kind of approach it that way. So I just wanted to sort of state my position. I do have a quick question regarding the metrics and the use of them as we talk about emergency meetings and whatnot, but also not wanting to just flip switches on and off. So I guess I'm looking for some clarification as to how those metrics will be used. Say we find out that we go above that 35 figure, is that going to halt sort of the process? And does that require any sort of action from us? Or is the point of the metric so that we know that's going to happen and we don't need to react to it?
Megan, can you address that? Can she? Dr. Leclaire, can Megan address that?
Yeah, if I could, I just say something and then Megan can build on it. You know, to my way of thinking, the COVID advisory committee, when they get together every week, they review multiple sources of data. And I would say that if the metric does climb above 30 or 35, whatever phase we're in, that it would be a triggering point to go to the committee and try to find out why. What are the nuances that we need to know about? And what other data is out there that we need to examine that might impact how we weigh a decision about making a recommendation to the school committee? I have said to the educators in the district that, you know, we are thoughtful in considering a lot of different data points. And so, Megan, I don't know if that's, if you want to correct me on that or if you want to build on that at all.
I think the only thing I would add is that it would not be a surprise that we're approaching 30 or 35, whichever particular population we're talking about. And so this group would have the weekly updates, and you would know which direction we're heading. And we would have the weekly COVID advisory meetings as well. So it would not be a surprise, and we probably would have some idea of what's happening. I think this actually what's happening right now is a nice example of when it gets murky, right? When we have what looks like a steadily declining rate and there's some volatility. And I think, Jonathan, what you're asking is that, no, that first time it pops over 35 or 30, you don't just want a dime shut down, right? You've got to wait for some of that stability. Was it a weird day? Was it a weird 4 days? That's why you look at 7 and 14-day averages. And yes, and this is to Maren's point before, you know, do we pick the 7? Do we pick the 14? They tend to reflect each other. And what Allison is saying is that we're going to look at both of those and see, is this a weird chunk of time, or are we really headed over 30 or 35, depending on the population?
I think I'm having some Zoom fatigue today, so I'm not communicating very clearly, but I certainly understand that you would want the directive that the goal is to open for the full populations on March 8th, and that would make a lot of sense. I think what I'm trying to express is how much I want to see a creative solution for busing. I feel like if I make a vote tonight to approve that opening date or that opening goal, and then we inevitably encounter the challenge, you inevitably encounter the challenge you will encounter in trying to make a more creative solution happen. And then we kind of revert back to the default of no busing for our older students. I would feel like that wasn't a reflection of the intention of my vote. So I guess that's maybe what I meant.
I get it. Yeah.
Cool.
I have to agree with Marissa here in that we have to be really clear, but I think that we need to make that decision tonight, not just about the metrics, but also about how we're going to move forward after the 22nd. And the reason I'm saying that is because, Allison, that gives you a full month to work out the details of the busing.
Yeah.
And
The more time, the more
I agree.
solutions, the more
but one of
problems
the
we can
things
solve.
that I wanted to suggest was, looking at March 8th for, can we go with cohort A, and then the following week go cohort B, and so that bits and I don't know, but like if we're gonna do grades XYZ on the 8th, can we do grades XYZ on the 15th and kind of get everybody in by the 15th?
I agree.
Or at least, okay, we have a meeting next week. We have a meeting, I think, again before that, don't we?
Yes, we have a
You have a
meeting on
meeting on
the
the 23rd.
23rd.
Yeah, and then we have another meeting the beginning of March, right?
March 12th, I think.
Oh, is it really that late?
I think it's the 12th. Maybe I'm
The
wrong.
16th? The 16th? The only thing is 9th or 16th.
It's got to be the 16th.
Oh, it's got to be the 9th then.
Yeah.
It is the 9th.
Yeah.
I'd just like to ask Megan, because in the COVID response team, she really has stressed that we cannot put this on a date. We really have to focus on the metrics. Even though, we say we want this, Megan, could you weigh in? Because I'm also exhausted, and I like when you say it better. I don't want to turn on a dime and do things like not, okay, Megan, you speak.
Yeah, so, I think that the point is that we have to pick these dates to start the planning.
Correct.
So our first
Right.
possible date is 2/22 or 3/8. But we need the community to be really cognizant of the fact that if the metric is not met, that's
Correct.
force the group in with a metric that's too high in an unsafe situation. I think that's the point that Lori's trying to make. If we haven't met that metric by that date, then we're talking about an emergency meeting where we push it out a week or 2 weeks or whatever we have to do.
Correct. But we do have to have a date, because if we don't have the date, then everybody cannot start planning. When you put that date out there, everybody is going to line up. Teachers are going to be ready. Parents are going to be ready. And yes, there are disappointments. There have been disappointments in my district. We've been running well, and then all of a sudden they have to slam it all down. It's horrible. But I think without a date, we won't plan correctly, and we won't be ready. So I think March 8th for everybody else, and I like the ideas, figure it out. But I love the idea of the 8th and the 15th. you know, get them in. I just don't want to have a long period of time where our families are just hoping to get the kids in and they're just waiting and waiting. 8 weeks is way too long. 6 to me is way too long. Let's do it as quickly as we can, in the hope that the city will get behind us and help us to make this happen.
Mhm.
So, what
So
I'm
can you take
thinking,
a motion, make a motion?
Yes.
Can someone make a motion on the metrics?
yes,
And maybe we can get that out of the way.
I'm thinking like 3 things. So let's start with the metrics. Does someone want to make a motion? Lori?
So I make a motion to bring back special populations. Is it February 23rd? Is that the date?
22nd.
22nd.
22nd, sorry. February 22nd, if we meet the metric of 35 per 100,000.
But it's not just
On a
special
2-week,
pops.
well, special pops meaning our special needs, our ESL, and our pre-K through 2.
One.
Sorry, 1. I told you I was too tired to do this.
That's okay. We're all tired. We'll get there. Okay, so we have a motion to begin on
Oh,
February.
and remote learning centers.
Right.
Yes,
Sorry.
I love the
Laurie
remote.
Garcia.
Yeah. I'm gonna rephrase it, make sure that we said it right. If the metrics remain 35, we will open on February 22nd for pre-K, K, and first grade special pops and our remote learning centers.
I second.
Okay. Any other discussion? All right, let's take a vote. Shannon?
Shannon Dunham, aye.
Marissa?
Marissa Curry, aye.
Jonathan?
Jonathan Schmidt, aye.
Maren?
Maren Goldstein, aye.
Lori?
Laurie Garcia, aye.
Mayor?
Mayor LaChapelle, aye.
And Cindy Kuzensky, aye. Woohoo! I'm excited. Okay. So then we want to talk about, I think just hoping to charge Dr. LeClaire with figuring out how to get the next group in. So we're looking 2 through 12, and we're
No
hoping
sooner than March
March
8th.
8th.
Yeah, no
And-
sooner than, put that in there.
yeah, and maybe do we want to talk about, before we do a motion, I like Shannon's idea of the 8th 1 week, the 15th the other. Again,
I'll make the schedule work if you want me to. If you just tell me you want me to get all the grades in 2 weeks, I'll
Yes,
figure it out.
please.
Is that how we want to leave it? So just March 8th? I like it.
So I will make another motion that we get the rest of our grades in if the metrics are consistent at 30 per 100,000. Yes. Okay.
Yes. On March 8th, right?
On
No
March 8th.
sooner than.
No, but no sooner than March 8th, but to get them all back as quickly as possible and have the busing to do it for the students that need it. Can I add that in?
Can we, maybe we should
For
do
the
busing separately?
neediest students.
Neediest. I said neediest. I did.
Yeah.
I said needy.
Okay. All right. Any other discussion?
Somebody has to second.
Can we clarify?
I thought
Go ahead.
Jonathan did. Okay,
I did
well,
not, no.
we've got some discussion. We've got Jonathan and Maren.
Go ahead, Maren.
Go ahead, Jonathan. You can,
I just wanted to, my discussion was I just wanted to clarify, like Cindy, last time you like reread what you understood the motion to be. And I just wanted to take a moment to clarify it. So if you have discussion, Maren, I welcome it.
go for it. Go for that clarification.
Okay. So the clarification is the metric is consistently below 30, no sooner than March 8th. All remaining grades within the span of 2 weeks is what we're saying. So my question was in relation to the idea of doing the 1 week and then the next week. Like, were we saying cohort A of one group of grades and then cohort A of the second group of grades?
Allison said she'd figure out the schedule.
Right, she's
Yeah.
gonna figure it
I've got
out.
to
We're
meet with
just,
the administrators and see what will work best. And
Yeah.
also
So
talk with the bus company.
yeah. So I guess my feeling is, like I appreciated that you were looking at the grades that were going to have either benefit the most by coming back, or we're going to face the greatest challenge to um, transition into what's essentially a new school. And I continue to feel good about supporting those grades first if it turns out there needs to be some sort of flexibility there. So if you can do it all in 2 weeks, more power to you. If you can't, I just want to say, I think focusing on the grades as you sort of presented them in option 2 was a good way of looking at it. And I just wanted to sort of put that out there as a part of our discussion.
I do believe that in a 2-week period, you can bring the rest of those grades in. So how do we want to phrase this? Do we want to rephrase?
Were we saying as quickly as possible? Is that the way that we were phrasing it?
That's what Lori said.
Yeah.
Giving priority to grades as laid out in option 2, if necessary.
I would just add in here that I think that with that language and with the directive that Dr. Leclerc is getting, we can then have a presentation on the 23rd that's going to clarify what is the proposal now. And we can that's enough so that your team can put that in, like start working on that. We can then hear the final details on the 23rd and approve it.
Yeah. Good.
Okay. If that's the motion on the table, I'll second that motion.
Okay. Sue, I hope you got that motion, because we kind of keep adding little bits and pieces. Is it okay? She smiled. All right. So if there's no more discussion, let's go on that one. Shannon?
Shannon Dunham, aye.
Marissa?
Marissa Crary, aye.
Jonathan?
Jonathan Schmidt, aye.
Lori?
Lori Garcia, aye.
Maren?
Aaron Goldstein, aye.
Mir?
Mayor LaChapelle, aye.
Cindy Kuzensky, aye. Excellent. And then the only thing I'm really concerned about is I'm just begging you to be really super creative. And I'm hoping that on the 23rd, you can come back with some really cool ideas for how we can reach out to the families that really need that transportation piece. I do totally understand that we only have so many buses and so many vans and we can only put so many kids on. But I think if we reach out to the families who super need their kids to ride, that we can at least address that need.
I agree. And I think it's worth reiterating a comment someone made before, that in order for us to do this, people that have the ability to drive their children to school really need to give up their child's seat.
Yes.
This is part of the community. If people can do it, they should drive their own kids to school, even if they are eligible for the bus, to open up a seat for someone that really needs it.
Yeah.
Okay.
All right. I don't
well,
think
you're not done yet. You have fall sports now. You have fall season.
Okay, that's right.
So I think as a way of intro, I won't say anything here except that Mr. Evans, I believe, shared a document with you late last week. And so I will, for the, to save time, I'm just going to kind of turn it over to him and let him talk to you about this. He's coming back to you again.
When did your school go back to school?
think
Hi.
someone's not
You
muted.
gotta mute.
Thank you.
So I am very much hoping that you received a 4-page document from her, a 6-page or really, really long document. Great, thank you, Jonathan. So really 4 things that we're asking the school committee to consider this evening. They're outlined at the top of the document, but I'll just read through those 4 items and just explain for the people in the meeting what the rest of the document is. I won't go through the rest of it, I'll just explain what it is. But the 4 things we're asking for, one is to allow the cheer team to practice during the fall 2 season and possibly, depending on other decisions, engage in sideline cheerleading. 2, to allow the hockey team to continue practicing through the fall 2 season, including practicing on ice 1 time a week in an ice arena. 3, to allow the basketball teams, boys and girls, JV and varsity, to compete during the fall 2 season. And 4, to allow the football team to compete during the fall 2 season. And just to clarify, fall 2 runs March 1 through April 22nd or 3rd. Brian can fill me in, can correct me there. The rest of the document that was submitted was an outline of the various safety precautions that are required through MIAA and that we are taking. So I hope you've had time to go through that and see all of that. And I would allow Brian and myself to be able to answer any questions you may have about any of those particular points.
One quick question I had just right off the bat. I noticed in the document, it listed a number of schools that participated in competitive basketball without any incidents of transmission. And I'm just curious if there's information about schools that participated that did have incidents of transmission.
Brian, you want to speak to that data?
Yeah, so schools have had cases of COVID, but nothing's been transmitted from teammate to teammate or opponent to opponent. So I put that out to all the athletic directors and all responded that they've had no transmission.
So there's no, all these schools didn't. There's no another side of it where all these schools did.
No, it was all, those are all the teams that are participating responded and said that there had been no transmission from either teammate to teammate or from one team to another. So there weren't any.
But there have not been a lot of schools playing basketball, correct?
Well, there are 38 schools that are participating, but some there have been because they've had to take a week off or 10 days off because one of their players contracted it from home or something like that. So they've had to follow that protocol. But all those teams are practicing and participating. But like, you know, as we said before, like if you're playing a team that's in the red, then they might have to cancel that game. So they're just following all those different protocols, but they are all practicing and participating when they can, yes.
So it's about, between you consider the boys, girls, varsity and JV, we're looking at about 140 games that have been played in the Western Mass area.
Lori?
One of my greatest concerns this whole time has been to get our students back in the classroom in a safe way. And I understand, I've said it many times, the benefits of playing sports and how it helps the social emotional health. But not only have I heard from my own students in my teaching district, but I've also read that there are many athletes, especially hockey players now, who have decided to stay in a cohort C. They've decided to stay home because their main goal has been to play sports and their academics have taken a back seat. I had one of my students actually tell me in December when they were practicing together, they had to go into quarantine for 2 weeks because of somebody that was there whose parent had COVID. And these are facts, these are statistics that everyone needs to know. and I know how eager they want to play, but as a school committee member and as an educator, I want to see them in the classroom. And I don't want to see students opting to stay home and not be in the classroom so they can play sports.
Anybody else? I'm looking for the write-up. That's what I'm scrolling through. I second Lori's concern. So I was just trying to scroll through again. When are you talking about starting this season?
Fall 2 starts March 1st. That would be when practices would start. And then the season, the actual games would start 10 days after that.
Okay.
Potentially.
And just to, I know that most of the fall sports were outdoors except for volleyball, but we did have a fall season while we were remote.
Right, but we're talking about indoor sports. We're talking about basketball indoors against other teams. And you're talking about actual games where you're up close. I just have to say, I agree with Lori. I want to get kids back in the building, and they need to be educated in a way that is more suitable to learning. And so that is in person if we can. And that is my highest priority. As far as being able to chit chat with friends, you do that when you're in school. You see each other in school. Yes, you're socially distant, but you were able to see and interact with your classmates. To me, that is the crucial part of this plan. I am really nervous about getting our kids in the building, and the idea of throwing sports right into that, even before we get, I'm okay with practice as we had set them up. We had approved practices like for basketball. But if you're talking about games starting, I would really hate to open up school and shut it right down again because of sports. That is my worry. And I'm not saying that we shouldn't be able to have some sports, but I'm not sure that timeline is logical for us trying to get our kids in the building.
I would only add to that, Cindy, that there is some imperative to start with the rest of the teams in the league. So if we vote to have sports during fall 2, that everybody starts on March 1 to make it an even playing field. And again, we'd have, according to the timeline, again, if all the metrics work out and everything is fine, we'd have students in the building before games are actually played. We are doing, skills and drills now for basketball and off ice for hockey. So I don't think that having this practice start on March 1 and competitive start 10 days later is completely offline with our return to school plan.
Okay, except some of our kids might not get into the 15th. So Dr. Leclerc.
I just want to weigh in and just remind everyone, because we talk about it so much all the time in the district. We have many mitigation strategies in place. And if we are practicing those mitigation strategies, if we refer to the Harvard Global Pandemic document, it says that if we are using mitigation strategies and they are proving effective, meaning that the spread within the schools or within the sports is no greater than in the community, then we should consider opening to a wider degree. Now, people may or may not agree with that, but I would remind people that restaurants are opening, health clubs are opening, all of these other places are opening without restrictions. And What we're advocating for is an opportunity for these students to participate in an activity in which we have a whole list, and you saw the list of mitigation strategies in place. And I think Brian probably shared more through the MIAA. You know, are they going to probably prevent every disease? No, but in some ways, I would rather have these students in our site under the supervision of adults that are ensuring they are taking proper precautions. We don't need to do the spectator thing like we did in, in the fall, we didn't do the spectators. We can alleviate all of that. But, I think that what I am hearing, and this is not through any reputable resource, is that students are out trying to have access to sports with students in unsupervised ways. And I would rather they do it in a supervised way where we are controlling the mitigation factors, which, so that's just I'm only saying that as my opinion. And that's definitely not, that's just my personal opinion. So I just wanted to share that out.
Yeah. Lori?
I agree with that, but I would like to say, as well as having to be tested weekly, I feel that students, once we open schools, they have to be in the building and not opt to stay home because they want to be able to play sports. Because I really have read that it's going on across the state, that kids are saying, I'd rather, play and not risk it, because their goal as students is to be students and play sports along with that.
Right. And we could mandate that these students be part of the pool testing.
Mm-hmm.
As another, as one of those mitigation factors.
Maren?
I'm just curious to get some feedback too on the requirements that we put forward for the winter season about weekly testing. Did that drop enrollment? Were students not able to practice that had wanted to practice? What did the impact of that requirement have on our student athletes?
Yeah, it dropped, probably about 15 athletes chose not or were unable to fulfill that. Some obviously, like for hockey, the numbers dropped way down. Only 2 kids are participating in that, just because to get tested every week and then only be able to, practice in the gym with a street hockey ball, they just decided that wasn't worth it to them. So I don't know if that was the testing or just, the rules that were in place. But I have had, numerous, at least, half dozen people who said that the testing was a deterrent for them. But all in all, for the most part, people were able to figure it out, although it was difficult in some cases. They're coming in from Greenfield, all over. And now UMass has cut back on their testing. So that's become a little bit more difficult. Some people can't get tested. They're over a week out in testing. So they've had to find other alternatives. But so yeah, it deterred a few, has been a bit of a burden on some, but most have been able to manage.
Now, with us going back to school, what do you think if we did like the initial test to be,
The rapid test?
before the 1st? And then if we're going back to school, we're not requiring all students to get tested before they go back to school.
No, but if we do implement the pool testing and include the athletes into that pool testing, then that could provide some additional help those students to make sure they meet their weekly testing requirement, and also help the school by having a pool of kids be in the pool testing.
Yeah, because that's 100 kids, that are registered.
Right.
So
the COVID response team would go along with that. Just remember, I'm speaking from sitting on that team. This isn't my perspective. When it wasn't, Laurie Garcia saying everyone needs to be tested. That was the advice that was given to us. to try to keep our community safe and get kids back in school. And now that we will have a pool testing option, as long as we're keeping kids safe and in school, that's what we want.
I agree.
Now, don't you guys have a policy anyway, Bill, that they have to be in school on game day, right?
Well, we've never had a situation where we've had students who could opt to be home during remote and play sports. That has been, we had a requirement through the fall sports season that the kids had to be in their remote classes to participate in sports in the afternoon. You're suggesting now that to play sports, you have to opt into the hybrid model when that becomes available, right? So that if hybrid is available, students, in order to be able to participate, I just want to make sure that I'm clear on this. In order to be able to participate, they have to opt into coming to school. And I just want to make sure that before you vote on that, that there's a good conversation about that, because I'm not sure I'm not sure that we've had an opportunity to think through what the implications of that might be for all of the individuals. And I hear the logic to it. If you're able to come to sports, you should be able to come to school. Like, is there a different risk? I just want to make sure that we think that all the way through before we add that on as a requirement for participation.
Okay.
Marissa?
Yeah, I guess I just wasn't totally understanding the logic behind requiring athletes to attend in person, particularly if one of the obstacles to attending in person is potentially transportation, and not just like a familial decision about public health or personal and public health risk. So I'm just wondering, Laurie, if you could explain a little bit more why you would want an athlete to also be required to come to school.
I wasn't even considering any transportation, Marissa. What I was saying that students have told me, because they had to quarantine for 2 weeks because of being in contact with somebody while they were practicing. This happened to be a hockey player. So he had to go into quarantine for 2 weeks because of contact tracing. And he said to me, I don't want to risk my not being able to play hockey, so I'd rather just stay home remote. And here the kids are saying, a lot of them, that they're not getting the education they need remotely, but it's their main goal just to get to play with their team. And they don't want to risk being in school. This is what he said. And then I read an article on it. There are many athletes who have just opted to stay home, even from private schools. They have opted to stay home, so they still will have the ability to play sports. And as an educator and as a school committee member, our main goal is to get them educated academically. And then sports come along with that, and it is very important, especially for their social, emotional well-being. But I want their main goal to be thinking academics.
But I do think it's really important, as Principal Evans is stating, that there may be other factors involved. So to just dictate, as a directive that you absolutely have to be participating in the hybrid model, there could be other factors that a student athlete may be choosing for any number of different reasons, that they need to not be doing the hybrid model. I just think that would be a little without getting information from the students or their families. I think to just make that a directive based on, I think it might be a little too overreaching in terms of sort of requiring that.
Can I speak to the?
I can understand that, like if they had to take care of siblings, for example. Like, and I do understand that, but you can understand as an academic teacher to hear a student saying, I just rather be playing hockey right now. And it was told to me. So that's my concern, Maren, but I understand. I don't want to make it overreaching. I just want students to realize that we're doing all we can to get them back into the classroom, and their main goal shouldn't be getting to the rink with their fellow players.
Brian wanted to say something.
Yeah, As far as the academic component, I've coached basketball for 25 years at the high school, and now I'm the athletic director. And we've always held our athletes to a higher standard beyond what every other student is required to do. So that they would choose to stay home, I find that you've heard it, so I'm not going to say that's not true, but I would find that hard for our athletes to make that decision. But even if they did stay home and were going remote, they would be held to that same high standard. So we would be checking their grades, coaches would be checking their grades, we would be checking in with their teachers, all those things that we've had in place for years. So even though if they did choose to be remote, they still would be held to that high standard.
Yeah.
I'm sorry, can I just bounce on Brian? One thing that I found very helpful when we are teaching in person, and not all coaches do it, at least in the districts where I've taught, is when there is a weekly check-in with a teacher for each athlete. It's not just based on quarterly grades or midterms, but every week the teachers have to let the coaches know. And I think then I would agree that if I know that students are doing their work remotely and are totally engaged as they possibly can be, and not just waiting for the grades at the end of the quarter, then I'd be more apt to say, okay, like I understand the other mitigating circumstances, but it really makes a difference when coaches hold students accountable.
So what we put into play, normally for me, I would contact all teachers with a list of players. And then we talked about putting into place where each coach will have access, or at least the varsity coach will have access to all the players' Power School, so that they can check grades consistently and check in with the players on a weekly basis. So through that, you can check on assignments, what assignments they're missing and things like that. We do peer tutoring where athletes, if they're struggling, after practice, they will get peer tutored, which right now is a little bit difficult, obviously, but that's in the past. So we have a lot of things in place to ensure that academic success.
Yeah. I feel a little bit better given that we are going to do the pool testing. So if we have everybody tested before they start to practice, and then we're able to do this pool testing, I do think I would want the players to do the pool testing, not opt out. But again, for me, basketball is the biggest concern that I have, because my daughter played basketball all the way through college, and it's a bump into each other right in your face kind of sport. And it's great, but that's my biggest concern. So the pool testing makes a big deal. Yeah, go ahead, Bill.
I'm sorry to interrupt, Cindy. The data is encouraging, from what we've seen from the teams that are competing. And we've all seen pictures in the papers of kids playing basketball with masks on.
Yep.
So I hear what you're saying, having played basketball, it is a close to each other's sport, but it seems to be working with the mitigation factors in place.
Yep. And really the reality is if you have a problem, you just have to close it down. So again, part of this is it's on our community to say, I want to be in and I want to play. You can't say I want to be in school and I want to play and then just take a lot of risks, because that's going to shut us down no matter where we go. So the pool testing makes a big difference for me. And the fact that we have spring coming, that makes, you can do a lot of things outdoors. So, anybody? Are we going to approve them one at a time, the whole package?
I'll just sort of weigh in as well that I think the pool testing is absolutely a critical point here, and that requiring that they be a part of that would definitely be necessary for me to even consider the thought. obviously football is outside, but football is very much also a
Yeah,
contact
very
sport.
much in your face.
And the thing that I kind of keep coming back to in my mind, and that I'm just going to put out there, is it is clearly the guidance that we have to remain distanced from each other, and we are specifically putting people in a position where they are not going to be. And I continue to come back to this idea of being consistent with the standards to which we hold ourselves. And I guess that's just a point that I'm kind of struggling to kind of overcome in my own mind as I listen to you folks talk.
I just have ask a clarifying question. So the pool testing for athletes and participating, is that in addition to or instead of a weekly COVID test?
Instead of, it would take the place, because once you get the results, if there's a positive, they get a Binax rapid now test on site at our school.
Okay. And that meets like MIAA requirements or like athletic requirements outside of what we have?
They're just ours.
They're your requirements. The
Yeah.
MIAA doesn't have testing requirements.
No.
Okay.
These were requirements, Mayor, that we had discussed in the COVID response team as like the only way to be able to bring athletes together this past winter.
So this is in
I
addition
agree.
to.
I'm not disagreeing. I just am trying to kind of think about a couple of different things.
This is in addition to the requirements or the baseline guidance from MIAA, which every school is following.
Okay, that was my excellent. Okay, that's where I was getting lost. All right, thank you.
But to take that step, just one step further in terms of testing, I mean, and what a number of people are saying is that I'm hearing people are feeling relatively okay with this concept.
You just froze, Maren. So hold on. You might want to log out and get back because we can't hear you.
Turn off the camera and turn it back on, maybe?
Yeah.
Wow, it was something probably really profound, too.
Okay.
My goodness, this is what happens to my students.
You are completely frozen, Maren. So
that's when I tell another student, text him or her. See what's going on. I'll text him.
Okay. Technology is wonderful when it is perfect. And
he's gone.
When it's not.
Did anyone else have any comments while we're waiting?
I mean, I'm just kind of thinking out loud here. I liked what you said, Jonathan, about kind of consistency. I think it felt easier for me to vote in approval of sports when we were in the phase of the year where there was really no chance of us opening our schools anyway. And so I felt like it was a choice that those families, those students were making that didn't quite have direct implications for our school community. It was sort of separate. You know, but I'm trying to think through how I can justify saying to families, we can't put your kids on a bus because we need to keep your children 6 feet apart, but other kids can play full contact sports. And if someone can give me a way to think through that and that I could be more supportive of, I would welcome it, but I'm just struggling with that dissonance at this point.
Too.
I mean, can I just some of the facts and the statistics, and I certainly understand, your point there, but there have been, there's 114 teams competing right now in Western Mass, JV, varsity, boys, girls. There've been, well over 1,000 participants for a month now, and there hasn't been a single case of it being transmitted from athlete to athlete. So I think, statistically speaking, those are pretty strong numbers. It kind of bodes well for the fact that we could, with all these safety precautions that we have and everything that we've been doing, We did it through the fall. We've been doing it in the winter. We've been able to keep our athletes safe. We have more stringent protocol than other schools. They're not requiring the testing and whatnot. And still, they have not seen an increase in cases through athletics.
But they have had to shut down, open up, shut down, open up consistently.
Right. So to me, that just shows that it works, that the protocols work, because if we have a case, we shut down. Other schools have shut down, and in that time, it wasn't transmitted to other athletes who are on their team. So to me, that just proves that the protocols are working.
Mir, I see your hand, but could we have Miran be able to finish his point first, since he logged back on, and then we'll call on you?
Absolutely.
Go ahead, Miran.
Apologize for that. I don't know why my internet crashed here. So, can you not hear me?
Just a little louder would be better. There you go.
Okay, I will hold this closer than I'm on my phone now. I apologize. I'll see if I can get the internet back on. So I guess the piece that I was asking is that it seems like most of the people's comfort was around having pool testing in place. And I did not feel like that we had required that going forward. We're looking at that to be a part of the 3-week pilot, but I did not feel like we had finalized or voted on to agree to pool testing for the entire rest of the school year. So I just wanted to raise that as a concern. If other people are sort of saying, I agree to this, but only if their pool testing is happening.
Right. Good point. Mir, and then Lori.
Yeah, so I have a couple of thoughts. I guess the point that the AD made about the protocols working, like for athletes in other places, I hear you. What red flags me there is one, because of athletics, it leads to incontinuity of an educational program because you have to shut down and you have to open again. I also would worry about the risk that the athletes are taking by playing, even with mitigative factors, on the rest of the student population who is choosing not to is choosing in person but not competing. I also would, on the other side of this or whatnot, and to Marissa's point or trying to rectify, I mean, what comes up for me between transportation and not being able to provide it and talking about in-person transportation for in-person learning versus contact sports, it's a resource issue that's above and beyond what we can control, which is the lack of buses. It's not for lack of wanting to do it, but we couldn't find the transportation. Maybe we could increase it a little bit and get more creative. But I just think it's two different. It's just a resource problem, and it's not about, like, if it wasn't resources, my prioritization would be get every kid a bus. But if there are no buses to be found, let's stretch what we have. And I separate that out from contact sports or the vote we're being asked to take right now. And then that also said, and again, I got a lot of feelings about student athletes, and just how a system is set up for inequity around that. We have kids not coming to school and not participating. And I feel we're at this point where if we can bring them back and the carrot is sports, then we need to get every kid back into school or engaged in curriculum that we possibly can. And for me, that weighs, that gives this weight. Like, unfortunately, there's no systemic consistent approach to this for a whole bunch of different reasons, and most of it's out of our control, including, the stats are good, with kids not getting infected playing athletes, the stats are good, but we know that 1 out of 100 can be an infection that affects thousands. So I mean, I would just, so obviously I'm not there either way and figuring about it, but those are the thoughts that that come forward in my head about this issue.
Mayor, if I could just clarify something about the shutting down. Shutting down is not shutting down the school. It's shutting down
Okay.
that program. That team can't practice and that team can't play, but it does
Okay.
not prevent the school from happening.
Thank you. I appreciate that. Thank you.
Lori?
I'd like to get back at something that Brian had said about the statistics of not being spread. We have no way of knowing that because of asymptomatic cases, and they're not doing surveillance testing. So our numbers in this Commonwealth are extremely high right now. You do not know. There's no way for you to say that somebody wasn't playing a game and didn't bring it home because they're not testing. So, and I do like what the mayor said about offering a carrot, because I know, once again, being a teacher for so many years, I know that students, as I said, have all of a sudden stepped it up and done really well when it was their season and they knew that their coach was going to follow. So I'm saying two different things, but that could get kids very engaged.
And there could be other carrots for different groups of kids around, I don't know, extracurriculars or presentation of curriculum, outdoor curriculum. Okay, I mean, the carrot thing jumped into my mind about athletics, and I think it's applicable maybe to other, you know, carrots as we're piecing this together with really like paper clips and tape. So.
Quick clarification to Principal Evans. When you say the program would be shut down, but not the school, I would assume, though, that if that student were, say, attending in person, that would have an impact on, at the very least, their class and cohort.
Right. So if a student were to contract COVID, then there's protocol for the team, there's protocol for the school, and they both have to be followed. And we'd have to do some tracing to see if they had close contact, who they had close contact with. The same. So all the protocols that are in place for managing students in school would still be in place as they are for athletics. But having a student be on a team that has one person had exposure may shut down part of that program, but doesn't necessarily need to shut down the entire school. I hope that's clear.
Mm.
If I could just say, and I know Brian has, I think, spoken about this previously, but just to let people know that I think that some of the concerns around, say, the sport of basketball would be addressed in the MIAA guidance, because there are a lot of restrictions around the playing of the game that would make it look different than it would have looked in normal, quote unquote, times, including from when the students actually walk into the gymnasium. They're not sitting on a bench. They're scattered throughout, the bleachers. They each have their own zone where they sit. They're not even sitting near one another. So I think that I would just, and Brian is far more the expert than I am here, but I would just want to make the point before you make a final decision that we're not talking about exactly the same type of looking game that you would be thinking of if you were thinking of your own children or you yourself playing that sport in the past.
Can I ask one point of clarification real quick too? Just particularly about games. So we're talking, of the 4 different teams, sports that we're talking about, 2 of them are about playing games, correct? So basketball and football. Are we talking about busing to those games? Because if we already have a transportation issue where we might have to shift things around to be able to get our students into school, to me, trying to figure out then busing to get our teams out to these sporting events seems a pretty low priority.
Yeah, the buses to, for a night game start at 5, 6 o'clock. So the buses aren't picking us up till 4:30, 5 o'clock in the evening. So yeah, normally, it's the same issue all the time, right? The buses are being used to transport students. And then when they're finished with those runs, then the sports buses.
And how does that, and does that also, I assume, then factor with the being able to meet the guidelines of whatever it was, 21 students per bus? So then some of these teams are going to need to take 2 buses and things like that, right?
Yeah, that's
So
what
this is not, so the transportation really isn't an issue aspect of this. I just want to confirm that.
Right. It would be later in the afternoon. In the fall, we did have to have a parent or 2 volunteer to bring their child to the game because we were at like 23 and we could only fit 21. So we asked for a parent to volunteer to drive. So we were able to work around that as well. But yeah, if we could possibly have to take 2 buses. We also use another bus company, Michael's Limousine, that uses coach buses, which they give us a competitive price to help us out. But yeah, there are other options to make that work.
I guess just to Dr. Leclerc's point, like, yes, I see that there are, it will look different in many ways. For example, I saw a change in the way that players take free throws for the basketball games. But assuming still say that they're going to play sort of like a one-on-one defensive scheme, you're going to have a player following the other player around, and you will be within 6 feet of that player for longer than the recommended amount of time that we be within close contact with a person. So there still is that point, I suppose, of again, I keep coming back to consistency and not putting ourselves in positions where we're increasing that risk.
But if I could be specific though, when we're talking about the gymnasium, we're talking about a much larger structure with a higher ceiling with fans that are circulating air up. So there's much more air exchange in that setting. And I don't want to speak for Brian, but I believe last fall with volleyball, they also required the exterior doors to be open so that they increased airflow further. So it has much more air exchange, probably more in line with an outside setting than with like an inside classroom. So you can, you guys can weigh in on that, but I just want you to think about that.
And I would respond also, Jonathan, that I mean, I agree with your point. When you watch basketball or football, you're not seeing people socially distance. But when we're out in the world, we're not also all complying to all of these other standards and safety precautions. So I don't get tested every week to go to the grocery store. So, I think that, as incongruent as that seems, I think that the list of precautions that are in place are designed specifically to mitigate the fact that there is going to be a lack of the standard social distancing that we use in our day-to-day lives. So I hear it. I agree with it. I think it all strikes us as an odd sort of juxtaposition. How do you do COVID and have these sports happening? But I think, we've got the safeguards in place and we've got the data to support that it can happen.
Once again, I'd like to say we really don't have accurate data because they're not doing surveillance testing. I'd also like to bring up again that there is only one medical professional, one doctor on the whole board of the MIAA. So I really can't rely so much on what they're saying because we're not sure. And they're also going to be within the droplet range when they're playing. And our epidemiologist has stated over and over again, when you're running and the mask gets wet, as soon as the sweat and it gets wet, the mask isn't working. How often are they going to be changing and getting new masks? This is all coming out of the COVID response team once again. I'm not the bad guy against sports. I'm just providing you with what we talk about.
Can I, on the MIA, I know we say that there's only one doctor there. Actually, they have the COVID task force, which it has doctors on that force, as well as the sports medicine committee. So if you just look at the board, yes, that's made up of athletic directors, but so in order to make these protocols, they go through their COVID response team. And then it's run by the sports medicine committee, which is made up of many doctors, athletic trainers, physical therapists, and things like that. So it's not just those people.
It's Megan. She's writing to me again. She keeps on saying no. She has done extensive research on who makes up that board. And if she's on, I'd like her to come on because
Sure.
there's just one. Megan, are you there somewhere? Because you're hearing, but you're texting me. Once again, I just relay the science to you and what our epidemiologist says. Are you?
Right. I mean, if you want.
Hi, can you hear me?
Yeah.
Yes. Hi, sorry, I'm on my phone now, rather than the computer. My battery issues on the computer. So that COVID group on the MIAA is made on the COVID specific board. There's just one pediatrician, and I don't know anything about if it goes through a second board after that. But the point that I was sort of reminding Lori about from our COVID advisory team discussions is that there's the airborne spread that we worry about, and being in a gym and sitting far apart when you're not playing helps with that a lot. But the bigger problem is being within respiratory droplet range, which is 3 and 6 feet, and that's just, you're not going to not be in that range.
So if anyone has any questions for Megan Harvey, please bring them up now. Once again, I have the task of sitting with these people week after week, and then it seems like I'm the bad guy to say no, but it's because I am relaying the science. And I feel so fortunate that we do have Megan because she does her research. Dr. LeClaire will tell you, she scrutinizes everything. And if she feels that she made a mistake, she comes back and she said, I was wrong, but I really haven't heard her have to say she's wrong often. She has been on point throughout this whole thing.
I'm definitely wrong sometimes. And I do really try to come back and say whenever I am. And I'm saying this as a former high school athlete. Listen, I was terrible at basketball, but I played all 4 years. And I know the importance of sports. And I want kids to be able to play. And the conversation that we had several weeks ago, granted we didn't have time at these last 2 meetings because we were talking so much about the metrics for reopening in person, is that it's really just, there's the data, which we don't have a lot of symptomatic cases being spread between athletes. We just don't. But we don't have surveillance testing. We don't know if there's asymptomatic spread. What we know is that we have really high rates. So it's possible. It's also possible that it's not contributing to spread. And I know that's not the certainty that people want to hear, but it's where we are with the data. And I think, that's all I can translate from the research. And you just sort of have to vote with your conscience on what makes sense moving forward. And I'm also just noticing that there's a picture of my child as my sort of screen here. So you can enjoy one of my future sports stars here who is desperately missing school. So, I say all of this as somebody who is absolutely impacted negatively by this dang pandemic.
If I can just make a statement or whatever.
Yeah.
It's almost 9:30 and I can see at least 4 football players on my screen and they need to go to bed. So one of the things, what I was going to say was at my work, how they do the contact tracing is if you're in close proximity with someone for more than 5 minutes without a mask, it's possible that you need to get tested. At no point are these guys, girls, whoever they are, face to face with each other for more than a couple minutes. And I don't care how much they chase each other around the basketball court. They are not in each other's face. It's front to back Like, it's not, like, they're not looking at each other in most cases. So honestly, we need to move on and vote. And I think
If I can clarify, oh, sorry. I just wanted to clarify that it's 15 minutes with masks on.
I said
Right.
5. See, look at that. It's 15.
With masks on.
On, yes, masks on.
They
So
are
that's
not in each other's space. A quarter doesn't even last 15 minutes. Without a timeout somewhere in there, right, guys? Come on.
8 minutes is a quarter.
It's 15 cumulative minutes. It doesn't have to be in a row.
right.
So I really don't think that this is going to be an issue, and these kids want to play so badly.
If it's possible, can we move forward with taking each sport as we've done in the past and putting it to a vote and being able to move forward?
Can we do football first? I make a motion to let football proceed with the pool testing.
I hear no second. Okay.
Do I need to modify it, you guys? Are you just against football?
Shannon, I just want to correct that, the way we're phrasing it. I don't think people are against football.
No, I'm just saying, do I need to rephrase the motion? And I can do that, but don't just sit there with dead air at me.
Well, the idea is if no one seconds the motion, then that motion does not go forward. So, I mean, I certainly think you can come back and rephrase how you want to do it, but should we look at another sport right now? I'm going to be really honest. My push, and people can be angry with me, is to get kids into the building. And I absolutely think the sports are great. I am concerned about basketball. I am. You're in somebody's face, and you can tell me there is a huge difference, Shannon and Bill, between being in a grocery store where you are not smashing up against somebody and sweating all over them, and or being in a restaurant. There is a difference. We're talking about kids being very close, up close and personal with each other as we box people out, as we try to block a shot. You go up for a layup. Those when we're talking about contact sports, we're not talking about baseball out here, out in a field. This would be a very different conversation if we were talking about playing sports, softball, baseball in the spring. I believe that. So I think that people, for my part, and I'm just not going to put a particular motion forward, but I'm well open to anybody doing that. For my part, I want to get our kids in school. That is the biggest healing. You want to heal our kids, get them in.
Shannon, can you restate your motion that wasn't seconded?
Why? I just said I want to make a motion to move forward to let the football play with the pool testing.
Right, okay.
They're outside.
And it would only be outside and with pool testing. You guys will all be shocked if Laurie Garcia seconds this motion. Just to have you drop off your chairs. I second that.
I would, in the name of more discussion, I would return to Marin's point that we really, besides the 3 weeks of pool testing that we're essentially moving towards, it is not something that we have guaranteed And I think it's hard to make it, an integral part of this, given that uncertainty.
So you'd have to rephrase it that we do pool testing for 3 weeks.
I mean,
Well,
that was
if it makes the motion easier, it doesn't have to be all or nothing. I can commit to doing pool testing during the fall 2 season, and then we can take the spring season when that comes.
The thing is, we're not requiring every student to test every week. The reason I said the pool testing, because we're doing it for 3 weeks anyway. And by that point, everyone will be back in school.
Yeah,
But they're going to be
it'll be March 28th. I don't know how long the season lasts. How long does it last, Brian?
April 22nd.
Oh, we'll see. Then the pool testing is already going to be in place.
I'll only second it if it's with weekly pool testing.
So what you're saying then is I felt like there was a question about after the 3 weeks of pool testing, the extreme cost associated with moving forward with that was something that I thought was going to be a reason for pause there. So to say that we're going to move forward with the pool testing, we're essentially also committing the money that goes along.
That's what I thought, Jonathan, but Brian just said pool testing only, I'm sorry, fall 2 only goes a couple weeks. So
No,
fall 2.
April 22nd.
April 22nd. Okay, then
It's
I
a
have
whole
to
other
commit
month.
to pool testing until April 22nd.
Yeah, if we're committing to pool testing, that's a budgetary decision that I think we should be making for the benefit of the full school community and not ad hoc as a way to push a particular sport through. It absolutely makes sense that pool testing would increase my willingness to have these sports, but I don't want to make this decision in a backwards way.
I agree.
There
I take
a
that for a
reason
second.
why we require weekly testing up to this point. Is that an option to continue with that?
Yeah,
I think that's a way to get
Absolutely.
around the requirement of pool testing, is that if we're saying weekly testing would be required, it may happen through the pool test, or it may be required to not be through a pool test, but still go out and find the test.
Correct.
So that is another way to get that weekly testing as a part of this component.
And I feel I understand that we're not requiring other students to do that, but this is an extracurricular activity. And believe me, I would rather not do the weekly testing just for my own sanity. But if that's what we need to do, then that's what we will need to do. And right, it could be a combination of the pool testing as well as, in requiring individuals to get a test. We could do that if that's the deal breaker.
So with that rephrase, it sounds like unless Lori is retracting her second, then it sounds like we have a motion and a second
With
for
testing,
weekly
yeah.
testing.
With testing, weekly testing.
Yep.
Any more discussion? Okay, Jonathan?
You're gonna put me first. Jonathan Schmidt, no.
Okay. Mayor, you pop up on the screen next, sorry.
Marin or Mayor? I'm sorry.
Mayor LaChapelle.
No.
That's easier. No.
Sorry, no.
Lori?
You guys are all saying no? Oh my God. I said with testing for outside football, outside testing, I'll say yes. Oh my God, what am I doing? I'm tired.
Marin?
Marin Goldstein, yes.
Okay. Shannon?
Shannon Dunham, yes.
Marissa?
Marissa Curry, yeah.
This is football.
Football.
This is
outside.
Outside. All right. Oh God.
I think cheers
I
is the easy
will-
one. That's 11. Oh, you have to vote. Oh my gosh.
I will say yes.
Good night, football players. Go to sleep.
Thank you.
Do your homework first.
So now we have to talk about the other sports.
I'd like to make a motion for cheer to proceed. They are also outside. They are no contact, no competition. I don't believe that we need to require them to have testing, perhaps an initial test.
I think I would agree that this is a much lower risk. I think so long as the pool testing is available, it's free, it's in school, might as well have them participate. But then if the district does not continue, I wouldn't see the need to require them to go seek a privately administered test.
Agreed. I think as long as the pool testing is available, that having our student athletes be a part of that pool testing makes the most sense for them to participate.
Shannon,
I would
is this
second
a
that motion.
Oh, I was going to say.
Wait, I just have a question though. You're seconding it, Shannon. You are the chair guru. But I never saw cheering without contact. They do all their pyramids and everything.
They said no stunting.
No pyramids.
No pyramids.
Okay.
This is going to be the old school sideline. Cheering.
6 feet apart.
It's not, yeah.
It's outside only. It's not inside.
That's correct.
Outside, yeah.
Including the practices?
Yeah.
Okay.
Yeah. And it may not start on March 1st because of weather. They could push it back a little bit as well.
Will they be 6 feet in mast? I didn't read everything. I admit
They
it.
always do. Yeah.
Yeah. Be 6 feet apart.
Arms
Fully masked.
out and measure. That's how far we have to be away from each other.
For everything, we put down, if we're indoors, we tape off the 6 feet. If we're outside, we use cones. Or if they're going to be in a specific area for like soccer, we created boxes that they would have to stand in to maintain their 6 foot distancing.
So I think we have a motion and a second. Maren seconded. Any other discussion? Okay, everybody keep shifting. So Shannon.
Shannon Dunham, aye.
Marissa.
Marissa Curry, aye.
Jonathan.
Jonathan Schmidt, aye.
Maren.
Maren Goldstein, aye.
Mayor. Oh, you're muted.
Mayor LaChapelle, no.
Lori.
Lori Garcia, aye.
And on cheering, I would say aye. Cynthia Kwasinski, aye. We have 2 more, right?
So I'll make a motion for hockey, which is to practice. This is only for practices. This is for social distancing. It is going to be in the facility, so it is going to be skating time. And I make a motion that along with our requirement, if pool testing is happening, that they have pool testing. And they've been testing weekly up to this point already, so they should already have a pre-test already in place.
I'll second that.
Any more discussion?
I'm not sure if I saw Principal Evans start to raise his hand about something.
I just wanted to thank you. I just wanted to point out that the ice time is once a week.
Right. Shannon.
Shannon Dunham, aye.
Marissa.
Marissa Curry, aye.
Jonathan.
Jonathan Schmidt, aye.
Maren.
Maren Goldstein, aye.
Mayor.
Mayor
Mayor
LaChapelle, no.
Okay. Lori.
Lori Garcia, aye.
And Cynthia Kwasinski, aye. Last one, the toughie for me.
So then I'll make a motion to allow basketball for boys and girls. This is for practice and games. This includes all of the stipulations that were required. It also requires, I would say that we require a participation in the pool testing if available. If not, then required, they do a weekly test to maintain their negative test.
Marissa, any more discussion? And do we have a second? I apologize. Holy. All right. You second. Okay. Do we have more discussion? Okay. Marissa.
Marissa Carey, aye.
Jonathan.
Jonathan Schmidt, no.
Mayor LaChapelle.
Mayor LaChapelle, no.
Maren.
Maren Goldstein, aye.
Lori.
Laurie Garcia, no.
Shannon.
Shannon Dunham, aye.
And Cynthia Kwasinski, no. Sorry. All right. That's it for sports, right?
Till the spring, when it will all be outside.
Yeah.
We're not there yet.
All set.
All right. Okay. That was tough. And I love basketball. So, all right. Nothing else. We're going to go on to our payroll.
I make a motion to approve school payroll dated 1/28/2021 in the amount of $540,147.74.
I'd like to second that.
Hey, Marissa.
Marissa Carey, aye.
Jonathan.
Jonathan Schmidt, aye.
Mayor LaChapelle.
Mayor LaChapelle, aye.
Maren.
Maren Goldstein, aye.
Lori.
Laurie Garcia, aye.
Shannon.
Shannon Dunham, aye.
Cynthia Kwasinski, aye.
Make a motion to approve accounts payable authorization for payment dated 1/28/2021 in the amount of $220,676.32.
I'll second that.
Marissa.
Marissa Carey, aye.
Jonathan.
Jonathan Schmidt, aye.
Mayor LaChapelle.
Mayor LaChapelle, aye.
Maren.
Maren Goldstein, aye.
Lori.
Laurie Garcia, aye.
Shannon.
Shannon Dunham, aye.
Cynthia Kwasinski, aye.
Make a motion to approve a budget transfer request to special education in the amount of $10,500.
I second that.
Marissa.
Marissa Carey, aye.
I'm sorry, Jonathan?
I was just wondering if there could be a brief explanation of the budget transfer, not that, just because it's, not something that normally, like, I understand we do transfers. Like, I just wonder if there might be.
Yeah, I don't have that printed up. Dr. Leclerc, do we have a? Oh, you're on mute.
Sorry, I don't have it open on my screen. Can you read it to me?
It's a budget transfer request, for special education of $10,500.
I'd have to
Sue?
look at.
I have
look
it.
at
I have it.
Sue probably has it.
Oh, is it in
It's-
the packet somewhere?
It's in the
It's
packet.
It's from the Summer Special Education Paraprofessionals Maple to Summer Special Education Teachers, Easthampton High School.
Okay,
It's just moving funds around to cover staffing changes.
gotcha. Thank you.
Mhm.
Marissa, you already voted, correct?
Yeah.
Jonathan?
Jonathan Schmidt, aye.
Mayor LaChapelle?
Mayor LaChapelle, aye.
Maren?
Maren Goldstein, aye.
Lori?
Laurie Garcia, aye.
You're losing your voice. Shannon?
Shannon Dunham, aye.
Cynthia Kwasinski, aye.
Motion to approve the minutes of the executive session on January 25th, 2021 to be withheld until matters are resolved.
I'll second that.
Marissa?
Marissa Carey, aye.
Jonathan?
Jonathan Schmidt, aye.
Mayor LaChapelle?
Mayor LaChapelle, aye.
Maren?
Maren Goldstein, aye.
Lori?
Laurie Garcia, aye.
Shannon?
Shannon Dunham, aye.
Cynthia Kwasinski, aye.
Motion to approve the minutes from the January 26th, 2021 regular session.
I'll second that.
Marissa Carey,
Marissa.
aye.
Jonathan?
Jonathan Schmidt, aye.
Mayor LaChapelle?
Mayor LaChapelle, aye.
Maren?
Maren Goldstein, aye.
Lori?
Laurie Garcia, aye.
Shannon?
Shannon Dunham, aye.
Cynthia Kwasinski, aye.
Motion to approve the minutes from the November 10th, 2020 regular session.
I'll second that. must have fell through the cracks.
Marissa Curry, aye.
Jonathan,
Jonathan Schmidt, aye.
Mayor LaChapelle,
Mayor LaChapelle, aye.
Maren,
Maren Goldstein, aye.
Lori,
Laurie Garcia, aye.
Shannon,
Shannon Dunham, aye.
Cynthia Kwasinski, aye. Does anybody have anything under other?
Yes, I do.
Okay,
This should be short, hopefully.
it's okay.
So,
It's important.
at the beginning of the winter season, we had a conversation about snow days. At that point, we made a proposal and it was voted and approved that we would still recommend that snow days occur and that as appropriate, they might only be considered late opening days if we didn't want to have too many full days that would carry into the summer. But as of this point, we've had 0 snow days. We've had at least 3 to 4 days that would have been appropriate to have full school closures with. And I really would recommend that we re-evaluate what we've done so far. I think that it's mentally a huge important part for our students to be able to have those sort of weather-related breaks, whether or not they can turn their computer on. It's still a mental break that is an important part of New England culture. And I think that we should allow ourselves to have the occasional snow days. So I would like to revisit that and see if we need to make a more strongly worded proposal to the superintendent to recommend having snow days.
I can tell you as a teacher, we're having that same conversation at our school because our students are really advocating to have just a day, whenever it snows here and there, to go out and play and just relax and shut off. So we're having the
I
same.
was very swayed by that young girl's letter tonight.
Yes.
I think I should call a snow day just for that.
I hope she's got her homework done and is in bed by now.
I hope so. It's very late.
I'm sorry, didn't I bring up you were going to research because we don't want the school year to go too far in June, that if there is like a snow day, like maybe one snow day, like a whole snow day, but you were also going to look at the possibility of making it, as Maren said, the half day. So it will still count as a day and then kids can still get outside and play. Did you ever check into that?
We can do that. I'll tell you that from a school calendar perspective, what I've taken into consideration thus far is that, all my days are starting to blend together because, we still work, even if it's a snow day. Today was a remote learning day, and I didn't call a snow day primarily because there's a half day tomorrow. So I think we've been in situations where I think we had did we have 2 snow days last week? But we also had like a day off during the week for another reason. So I was kind of, to call a snow day, I'd like to call it on a week when we have a full week of school, and it would really, I think, be a beneficial rest day, not when we have a week where there's days off for teacher professional development or days off because of a long weekend or something. So that was what I was waiting for. But that young lady tonight, I think I should call, the next time it snows, I think I should call a snow day just because she advocated for it.
I agree.
Call it Victoria Day.
I like it.
Was that
I
it?
like it.
Okay.
I
But
like
the
that.
teachers need it just as bad as the kids do.
It's true. It's true.
Well, it's 6 of one, half dozen of another. If I have to say, honestly, if we were in the new building, I would have a different feeling than I do now. I think all of you realize that spending days in the hot elementary schools in June is not really comfortable for people. So that's why I'm trying to push through a little bit here, because I know in the summer, I'll get more complaints about how hot the buildings are when we're back in person. So I'm trying to be thoughtful about that. And I have to say, out of about 1,500 students in the district, I hear more positive thank yous from parents than I do. I might get one negative from someone, and I know I don't look at social media, you know that, so I know people could be complaining about that, but if they're not contacting me, I don't count it. But you know, for the most part, it's much people are favorably saying that they would rather just go on. So, but I don't disagree. I think I will plan on sneaking one in there.
Her name was Vivian, by the way.
Vivian.
Yeah.
But she had a sister too, but I can ask her mother.
She
Anything
was
else on that topic?
great. Oh my God, she was the cutest thing.
I was going to throw out another just in relation to sort of talking about our committee's practices and open meeting laws that we follow and why public speak is the way that it is, because I know it's frustrating and confusing. I don't believe the person in the audience who spoke to it is still here, so maybe it's better to talk about another time. But I don't know exactly where that comes down from, but I know it's
I think that's Robert's rules.
I think so too.
But the mayor
also,
would know more than
Allison, you had sent out an email a while back as part of the other, I'm throwing this in, because I wanted to kind of respond to that gentleman, Peter, I think his name was. You had mentioned a while back doing a Q&A, like a school committee superintendent
Yeah, and
hour
I didn't
kind
have any takers. Do you guys want to do it?
Yeah, that was
I don't mind doing it.
Yeah, that was going to be my my hope, is that we do some sort of question and answer.
Yeah.
Like the forums that happened that were grade and school specific were really helpful for
Yeah.
parents to be able to answer and ask questions. And I think it's important for people to be able to have that back and forth. It just can't happen in a school committee meeting. So I do think we could put it out there as a possibility, and hopefully people will want to come.
Yeah, I think that's a great idea. I'm doing the teachers this week. We're doing all the town hall events for the teachers. So I'll plan on doing the families the week of the 22nd. I'll schedule some events that week. I would add, though, that we're also working on, in the survey that we just did last Friday, parents said overwhelmingly on the question asked about what kind of format they would like a frequently asked questions document. That's what over 50% of them wanted that as and a smaller percentage wanted like a Q&A session, but they really want a document. So my team is working on a document right now.
Why don't we do something like right before one of our meetings or something, like a half an hour before?
Well, we could, but we have finance at 4 o'clock every Tuesday.
Oh, that's right. Okay.
Yeah.
Can't exactly do it after. It's 10 o'clock.
Right.
Right.
All right. So we have an executive session after this. Do we have a motion to adjourn?
I will motion to adjourn.
Wait, no, the motion, we need to not adjourn.
Excuse me, thank you. A motion, see how tired it is? Thank you, Maren. A motion to move into executive session.
Sorry, I'll make a motion to move into executive session.
I'll second that motion.
Everybody will second that. Okay, Jonathan?
Jonathan Schmidt, aye.
Maren?
Maren Goldstein, aye.
Marissa?
Marissa Curry, aye.
Lori?
Lori Garcia, aye.
Shannon?
Shannon Dunham, aye.
Mayor LaChapelle?
Mayor LaChapelle, aye.
Cynthia Kwasinski, aye. We will not be returning. Have a good night, everybody.
Night, Jacob. Jacob.
Can we take a 2-minute break?
Yes.
Yes.
Yes. How many minutes did you want?
I'm sorry, what do we?
5?
5 minutes? 5 is good. 5 is good.
5.
5 would be good. Okay. And we can't resume until it's just us anyway. So, okay. See you in 5.
Hi.